आशीष सर। आशीष सर।
हाँ शिल्पी नमस्कार।
गुड मॉर्निंग सर।
मोहित जी नमस्कार। आई थिंक प्रोफेसर अनिल सर भी आ गए हैं। अनिल सर नमस्कार।
सर आई थिंक वी शुड बिगिन, इट्स ऑलरेडी 10।
अच्छा डॉक्टर संजय नमस्कार।
नमस्कार 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 जी।
जी सर।
गुड मॉर्निंग सर।
हाँ मोहित जी नमस्कार।
स्क्रीन ठीक है? स्क्रीन ठीक है?
हाँ ठीक है मोहित जी ठीक है।
ओके ओके सर। इसमें कनेक्ट कंटेंट वाला जो आता है वहाँ का निशान हम पीपीटी दिखाने हैं तो कनेक्ट कनेक्ट कंटेंट वाला ये भी करेंगे। अच्छा बाद में करेंगे हम। सर इस बार मैं बोलूँ नहीं सर को नहीं वो कंटेंट का तो कौन बोल
आशीष सर।
हाँ एक बार मैं अतुल सर को फोन करता हूँ।
ओके।
हाँ मोहित जी।
जी सर।
सर आ गए धर्मेंद्र साहब?
हाँ सर, बस आने वाले हैं, अभी उनको फोन कर दिया है, वो
ठीक है
गोइंग टू ज्वाइन।
ठीक है ठीक है, मैं अतुल सर को भी मैंने फोन कर दिया, वो आ रहे हैं।
ठीक सर, ठीक।
जी। 2 मिनट इंतजार करते हैं, फिर शुरू करते हैं। मोहित जी शुरू करें। मोहित जी, आई थिंक वी शुड स्टार्ट। हाँ, हेलो, अनम्यूट कर लीजिए मोहित जी।
ओके सर, कैरी ऑन सर।
शुरू शुरू करें।
राइट सर, राइट, प्लीज।
ओके, थैंक यू। Wonderful and warm good morning to everybody present here. I welcome our guests of honor, Director of Fire Service, Shri Atul Garg. He is going to join right now. Professor Anil Gupta, sir, from NIDM. ADM Delhi West, Shri Dharmendra Kumar ji, as well as our distinguished speakers today, Professor Jugal Kishore Saab, Dr. Sanjay Tomar ji, Shri Somendra Pal Rana ji, Shri Nakul Tarun ji. I also welcome our beloved participants for taking time out today to join us in this wonderfully conceptualized webinar. That's being jointly organized by NIDM as well as DDMA West Delhi. As we all know that disaster resilience is the ability of individuals, communities, organizations, and states to adapt to and recover from hazards, shocks, or stresses without compromising long-term prospects for development. Disaster risk reduction and resilience interventions aim to reduce and mitigate the risk of displacement and increase the resilience of communities to cope with disasters. As far as resilient cities are concerned, they are better positioned to protect and enhance people's lives, secure developmental gains, foster an investable environment, and drive positive changes. Academic discussion of urban resilience so far has focused primarily on three distinct threats to cities. One is climate change, one is natural disasters, and the third one is terrorism. If we believe the recent UN report in this regard, why the world needs to focus on resilience, about 1.4 million people move to cities around the world every week, and nearly 55% of the world's population now lives in urban areas. Such rapid urbanization can strain local capacities, contributing to increased risk from natural and human-made disasters. Also, the poor and vulnerable living in substandard hazardous places are most at risk, with about 1 billion people living in slums. Then how to build resilience? The cities can protect against economic shocks by diversifying their economy, creating opportunities for business and employment, engaging private sector. They can also build socially cohesive societies which become democratic, which become sustainable, and also they employ inclusiveness by ensuring residents from all backgrounds which take part in decision making. So in this light of this ever increasing population surge in tier 1, 2, and 3 cities of our country, due to mass migration from villages and subnational levels, which is the new normals of this pandemic, it is time that urban disaster risk resilience needs to be seen as a very serious, important factor. Catching this importance and this concept, the NIDM and DDM at Delhi West have organized this joint webinar on urban disaster risk resilience. Today, we are going to witness very important discussions and with regard to various facets and concepts and aspects of urban disaster risk resilience. I invite Ms. Shilki, young professional NIDM, to continue with the inaugural session now. She is young scientist and young professional in NIDM, working in the forest biodiversity and animal inclusive disaster risk reduction section of ACDRM division of NIDM. She has keen interest in eco-DRR, sustainable development, nature-based solutions, and ornithology, the science of birds. She is presently also working on one AIDRR compendium as well as AIDRR training module in NIDM. Over to you, Ms. Shilki.
Thank you very much, sir, and very warm welcome and good morning to everyone present here. And to begin with our inaugural session, I request Professor Anil Kumar Gupta, sir, to kindly deliver his opening remarks. A disaster mitigation and crisis management professional, Professor Gupta possesses interdisciplinary expertise with institutional development, coordinated several international and national projects, over hundreds of academic publications, etc. He also served at NDMC, DMI, NIDM, SICON in administrative or technical capacities. He is a coordinator of Technical Advisory Committee of NIDM, member of Governing Council and academic or research advisory of several institutions and high-level ministerial delegations abroad. I request Professor Gupta to kindly deliver his opening remarks for today's webinar. Sir, over to you.
Thank you, Silky. I am very happy that a district administration has taken this initiative because it is almost 2 decades. I have been advocating this, that if we really want to bring disaster resilience on ground, the district administration is actually the real administrative unit for planning and also execution on ground. And I recall our period of 2012 and 13. We took first of this kind of study, that how each and every developmental department of the district administration can integrate and need to integrate climate change adaptation and disaster resilience. And then the second phase of that study that was supported by CDKN, we chosen that how the linkages with the urban development, urban planning, and various sectoral dimensions of urban planning should integrate this. So my compliments and my congratulations to the entire organizing team for taking this very pertinent initiative. As far as urban, the title goes, urban disaster resilience. There I would say that probably we need to be little more broader. And why I say that we need to be little bit more broader, because now we are saying that we should not wait for disasters to happen. And resilience is the ability that how effectively we bounce back after the disaster is over. So we have to be a little more broader and more advanced with our experience of dealing major urban disasters of all types, whether earthquakes. For example, Nepal earthquake has given the latest lesson. But if we look at the past earthquakes like the Bhuj earthquake, Kashmir earthquake, several of the urban centers got a very severe level of devastations, and on the other hand, Delhi is also having that kind of risk, because in past few months only we had a series of small tremors, and on the other hand, the kind of real estate growth and kind of the questions whether all these new buildings are really taking care of the earthquake safety or not. On the other hand, as now we focus that we have to leave the disasters behind, but rather look at what are the hazards and what are our vulnerabilities. Because in case of earthquake, we say that it is not the earthquake that kills, it is the building that kills, it is the infrastructure that kills. So how effectively we look into the safety aspects in design. But yes, organized buildings, government buildings are big housing complex, we can take care. But even private builders, then they are constructing, some people are constructing their own houses in slum dwellings. So how to take care of the things who are having quite less capacities? So that is another important dimension. Second aspect I would like to focus here very briefly, that urban resilience, when I say urban resilience, that includes urban disaster resilience, urban climate resilience, and in fact, the overall urban resource resilience, because water resource and energy, I think there are two very important dimensions, and even transportation and other things, without which the city cannot sustain. So city resilience or urban resilience cannot leave talking about the rural urban connect. So that is important. If we talk only of the city resilience and we do not look at that, what is the relationship with the rural areas, like in Delhi, our core urban area is surrounded by a number of villages, and there is a close input output relations. So we need to take care. And there is a transit area that we call it the peri-urban area or the fringe areas. And peri-urban areas, most of the people, that is the labor market, that is the vegetable market, and a lot of waste treatment plants are there, but that also provides lot of tourism facilities. So there are a lot of plus and minus. So looking at peri-urban ecosystems and peri-urban resilience, peri-urban, the people who are occupying peri-urban areas, we need to look at that also. Then if we list the issues when we talk of the smart city, so I say that the city should be smart in dealing with the disaster risk as well as the climatic risk also. So when we say smart city, then we are advocating that smart city start looking at the increased uncertainties of various disaster events or extreme weather events also. And then we witnessed during this coronavirus pandemic period the issue of floating population, that the people who are not actually the citizens of that city, but a number of people are coming and going every day. For example, a large number of people are coming to Delhi from nearby towns and cities and villages. And if something happens, in earthquake strikes or some fire happens or flooding happens or something happens, then how to deal with this kind of people who are not actually the resident of the city. Then migrant population, that we witnessed that we never had any kind of a registration for quite long time, but recently now we realize that a proper record of the migrant population is very important, as we had to deal with a parallel kind of disaster during the coronavirus period, first lockdown period itself. And we also need to learn from the cities which have adapted to changing climate and changing scenario of uncertainties. For example, in US, Chicago is a city which has transformed itself to the greener city. So now looking at the rainwater harvesting systems, looking at the green roof kind of things, and then even the vegetable growth, like going vertical, because land is a limiting factor. So can we vegetable cultivation and all kind of things, can we go vertical, because that will have the dual benefit of carbon sequestration as well as the agriculture and food productivity. And the last point that it comes, that I would say that health city. So how the city itself can be healthy, and city can ensure, or the city administration can ensure that the people dwelling in that city are healthy. So I am not talking only of the health facilities. Yes, certainly health facilities are important, but how the people are healthy. So on one hand, we need to ensure that people do not fall sick. People have better facilities, better amenities, better waste management, so that better pollution management, so that people are not undergoing ailings. And on the other hand, we have effective health delivery systems. And the last point, that when we are talking about safety, so safe city. On the other hand, we are talking of the disaster resilience. On the third aspect, we are talking about the climate resilient city. And the fourth, we are talking that the eco-friendly city. So many aspects of dimensions are, so many dimensions of the city resilience is there. So we need to evolve an integrated framework. So integrated city resilience framework is required. Currently, we have taken up some pilot study, taking some of the hilly cities to look at that how this integrated framework should look like. And very shortly, we will be sharing our research result also. So with this, I hope that today's deliberation would be really very useful and of practical insight, because Delhi is going very fast, and Delhi is also trying to transform into a resilient city. So it has a dream of becoming a disaster resilient city, climate resilient city. So let us work together, and let us look at the fruitful discussions of the day. And I see here a lot of friends, lot of known colleagues as speakers. I'm really very happy to be here. Thank you, and over to Shri Pandaji and Ms. Silky. Thank you.
Thank you very much, sir, for this wonderful opening remarks. And you talked about smart cities and building resilience in the urban cities. So this is really important in today's scenario. Thank you very much, sir. Now I request Sri Dharmendra Kumar, sir, ADM New Delhi, ADM Disaster Management Authority. He is working as additional district magistrate and CEO of DDMA West since December 2019 in the Revenue Department of Delhi. He has been working from July 2013 to August 2016 in Andaman and Nicobar Island on at various capacities. In Delhi, he had been working as SDM Saraswati Vihar in North West District of Delhi as an additional district magistrate of New Delhi. Sri Dharmendra Kumar is very sincere towards disaster reduction. He has been doing very hard job during COVID-19 pandemic situations to make the district COVID free. So, sir, over to you for your inaugural remarks, please. Dharmendra, sir.
Ma'am, just he's now going to join.
Okay. You can wait. Sir, can we invite Sri Atul Garg sir until ADM sir join? Okay.
Okay, ma'am.
Okay. So we now request Mr. Atul Garg sir for his special address, sir. Shri Atul Garg is presently holding the post of Director at Delhi Fire Service. Shri Garg is a recipient of Fire Service Medal for Meritorious Service on Independence Day 2019, and he was born in 1965. He is a graduate in fire engineering in year 2000, 1988 from National Fire Service College, Government of India, Nagpur. He further obtained his master's degree in MBA, Disaster Management from GGS IP University, Delhi. He has served as Deputy Commandant in Central Industrial Security Force before joining in Delhi Fire Service as Divisional Officer in 2002 through UPSC and subsequently promoted as Post of Director, Delhi Fire Service in the year 2019. Shri Garg is a precocious fire officer, is wholly committed to his duties and always leads his subordinates from the front. During 26 years of service span, he proved his capabilities by working at important positions in the organizations. He has many accolades his credit while serving in each and every organizations. His service has been recognized by awarding the President's Fire Service Medal for Distinguished Speaker Services on the occasion of Republic Day 2020. Sir, over to you for your special address, please.
Good morning to all. I am Atul Garg. My voice is clear. Can you hear me?
Now it's clear, sir.
Okay. So I will restrict myself only to Delhi. See, Delhi is already 4 zones. And as Mr. Gupta was talking about this building, the walls and other things. Hello? Hello?
Yes, sir, you're audible.
Please continue.
Sure. Okay. Okay. So I will be restricting myself to Delhi only. So now I will share some data of Delhi, like Gupta sir was telling. See, Delhi, one is authorized building, one is authorized building, Landora building. And as per the data we have collected, all deaths, all collapse has occurred in unauthorized area, in the village area, not in the building which has been constructed as per plan. So major issue for us, Delhi, that 70% Delhi is people, as per the news, that 70% Delhi is residing in the non-conforming area, that is called as unauthorized area, Lal Dori area, village area. And the maximum incident of fire, maximum incident of death are occurred. So as I will request the administration, they should focus themselves to in that area. Presently, whatever I am getting the calls from this administration for issue mock drill, all other things, that are only in the building which have been already constructed as one. They have already well-built fire safety system are available, but nobody is conducting mock drill, educating them the area where the 70% population are residing of Delhi. Moreover, their structure is not known, like Hodgers village. They are built in a 1 day or 2 day, 3 day, like in Delhi is a common thing. Tukli pe bane hai. So we are not taking this. Even myself are not taking it. My department is also not doing it. And like that earthquake occurs, there will be disaster. Nobody will be. I will not say as a director of this, but it will be a really disaster because the area which have been constructed, nobody knows whether there is a beam, there is a something else, or whether there is a tin, whether there is a tukli. And population, as I am again saying, is residing in this area. This is a floating population also residing there. There are guest houses, there are illegal paying guest room also, like Munir Ka, Kalesrai, Gandhinagar. There is a thick of, and we have not conducted any mock drill so far in this area. Not of any infection in the area. Another example of this, where we have so many deaths because it is a house and their industry was running. So Delhi is facing this challenge, where the authorized area is only 30 to 25, and as per data available with us, last 10 years there is no major fire occurred in a big building, which is called a high-rise building, or and no death occur in a high-rise building. all deaths are occur either in industrial building, all house collapses occur in the non-conforming area, and all fire or deaths occur in the plotted area which are not governed by any law. So my request to all of that discussion should be focused on these areas, not the building which have been already constructed as per plan. They have all firefighting system, all escape route, everything is there, and they are getting NOCs every 3 years from the fire department or the department also. We should, if we want to save Delhi, we should shift our focus to these areas where which more data is available with us. Recently, we have requested the electricity department also, because what we saw from last say 5 to 6 years, that all that in apartment building had occurred due to the electricity meters and all things were installed in the near to staircase, and they have only one staircase. In case of fire, the staircase is full of smoke, and they have tapped there and died there. We take up this matter. We took this matter to this building authority, and they have agreed. And building by laws has been also being amended for this. So these are the core area as far as Delhi is concerned. Whether we all should focus, we should all our energy should direct it, not thrive like Maulas. Whereas Mr. Dharmender Kumar, he is a ADM, he is our AC fire also. We have worked with him. He was in fire station almost more than 1.5 years, and he is very knowledgeable person, and that's why I think he has taken this initiative to start this. And really, it is a very good step as far as disaster resilience is concerned. And I hope the all other district administrations of all areas, the different areas, they will also come up with this idea. Thank you so much. Over to you.
Thank you very much, sir, for your wonderful special address. And I now again request Sri ADM sir, Sri Dharmendra Kumar sir, to kindly deliver his inaugural address. Mohit sir.
Yes ma'am, going to join कर रहे हैं, वो link दे दिया हमको है ना
जी. I again request Sri Dharmendra Kumar sir to kindly deliver his inaugural address, please, sir. Dharmendra sir.
Yes ma'am, he has joined.
Yes, sir. We welcome you, Dharmendra sir.
Yes, am I audible?
Yes, sir, you are audible.
Namaskar, sir. Audible, sir. Please.
Dharmendra sir, you need to unmute yourself.
Yes, it's already unmuted.
Now it is. Then again, mute हो गया फिर से.
सर म्यूट हो गया है सर आपका.
नहीं सर, अब फिर से अनम्यूट मैंने कर दिया है. एक बार आप देख लीजिए एक बार.
आवाज नेटवर्क प्रॉब्लम.
Dharmendra sir, I request you to kindly keep your video off so that we can hear you, because your bandwidth is really low.
सर बोल तो रहे हैं सर की आवाज नहीं आ रही है.
Sir, he is unmuted. Now he is muted. Dharmendra sir.
Yes.
जी जी. आप ऑडिबल हैं सर.
Yes. Yes. So start. You can start the meeting, no?
Sir, it is started already. आपका inaugural address है sir.
Then am I?
Yes sir, you are
Okay.
audible.
Okay. I welcome all the members in this meeting. Disaster management. Actually, all we are facing a huge kind of disaster in the form of corona, which is very contagious and very lethal disease. But but on the basis of our 9 month experience and the support of all the emergency support members, somehow we are able to fight this disease very bravely, and now the situation seems to be under control. However, due to this disease only, we were not able to meet regularly how we used to do in the past. The mock drills are held up, and many physical activities are held up other than this activity. Actually, we are doing corona thing, but again, other kind of disasters like fire, and we always used to do the mock drills on the earthquake kind of things. But due to COVID, this has not happened physically. However, in the past, we used to meet online, and again we are repeating this, and this is very important to keep meeting and keep inculcating the things in ourselves and be ready for any kind of disaster to mitigate the human loss economically and in the form of life. So I welcome all the members and to give useful inputs, to rehearse, to repeat, and give your important suggestions so that our district can be prepared fully for fighting any kind of disaster and mitigating the human, economic, and life loss. So I welcome all the members, and I will request the coordinators to invite the speakers accordingly. Thank you.
Thanks a lot, sir, for your inaugural address. And now we should move ahead with our technical session. And I request all the speakers to kindly deliver your deliberations in 20 minutes of time. And all the other participants need to keep your mics muted during the webinar. So now I request our first speaker, Dr. Sanjay Tomar sir. He did BSc from Delhi University and MBA in disaster management and a PhD from Guru Gobind Singh Indraprasth University, Delhi. He has more than 29 years of experience in fire prevention and planning, fire ground operations and rescue. His areas of specialization are applications of remote sensing technology in fire services and disaster management. He has worked in Indian Railways, Delhi Fire Service, and Delhi Metro Rail Corporation as Senior Manager, Fire. He has visited Hong Kong and Bangkok in connection with the study of fire safety arrangements of metro rail networks. He is a recipient of President Fire Service Medal for Meritorious Award services in the year 2013. He was associated with training of national and international students at Training Center Delhi Fire Service and Fire Safety Management Academy Rohini. He has imparted fire prevention and fire safety training to many government and semi-government and PSUs and private organizations. Sir, over to you for your talk, please.
Good morning, all of you. Am I audible?
Yes, sir.
I'm just sharing my screen for PPT presentation. PPT is visible. Is my PPT visible?
Yes, sir, it is.
Yes, visible.
Yeah, so
Sir, full screen कर लीजिए.
my presentation is disaster resilience role of fire services. Delivering this PPT in three parts. In first part, I will be discussing existing situation with respect to fire and other emergency incidents in Delhi. And in second part, I will be discussing prevention, preparedness, and mitigation measures for fire and other kinds of disaster. And third one, I will be discussing use of modern technology and equipments to deal with many kinds of disaster, which we can be facing. So Delhi, as we
Sir?
all know, is a very congested.
Sanjay sir, I
Yes.
request you to kindly do a slideshow. Full screen कर दीजिए sir.
Okay. Visible?
It's coming sir. आ गई sir. ठीक है.
Okay. So Delhi's problem is dense population, congested road, presence of Jugi clusters, big commercial markets like Super Bazaar, Chandni Chowk, Parol Bagh, unplanned and unauthorized residential settlements. A major fire breakout will be disastrous with heavy loss of lives and property. So as our directors have said that we are having two kinds of settlements in Delhi. One is planned city and another is unplanned settlements where we got most of the fire calls and which results in most of the deaths in case of fire and other collapses like building collapse as we seen in Lalita Park building collapse case. So Delhi, when we talk about a disaster, it can be earthquakes, it can be floods, it can be fire, biological disasters, man-made disasters, and so these kinds of daily receiving, not in the proportion, but Delhi Fire Service receives nearly 31,000 fire and rescue and other emergency calls annually, which involves fire incidents, road accidents, building collapse, human, animal, and bird rescue, lift rescue, sewer rescue, drowning rescue, bomb and explosion threats, terrorist attacks threats, chemical, nuclear, and biological. So these kinds of fire calls we are dealing with daily, or annually we are receiving more than 30,000 fire calls. You can see the situation of unauthorized, unplanned colonies, human settlements. If any earthquake takes place here, you can very well imagine how the people who are residing in these is a most vulnerable people, and we should focus our all our strategies or planning in these areas, not in the planned settlements or in areas where we already given them NOCs or which are planned, which are constructed as per the approved plans. Jugi clusters. Now, consequences of a major fire will be disastrous as it may lead to total building collapse. and we have already sacrifices 4 of our brave firefighters in these accidents in the recent past. So you can see that the last 3 years, the total count of the fire calls is around 30,000 fire calls, in which nearly 300 people are getting died, or injuries more than 1,500 people are getting injured. So Delhi is more prone to fire emergencies, and certain areas are more vulnerable to fire incidences. You can see that the planned Delhi and unplanned Delhi. We have analyzed the statistics of the fire and other emergency in both the areas, and you will find that most of the fire and deaths are happening in the unplanned city. So for operational control, Delhi Fire Service has got 3 zones, and we have got, each zone has 2 divisions. So we have 6 divisions, 18 sub-divisions, and total 64 fire stations, 3 disaster management centers at Roni, Nehru Place, and Lakshminagar. Distribution of fire incidents at Delhi has been divided into 3 zones, and you can see the number of fire calls is nearly same in South Zone and West Zone, and New Delhi Zone, which comprises this Central Delhi NDMC area. The fire calls and the other emergency calls are less. As if we do fire and other emergency calls division wise, then we can say that North 22% of the total fire calls we receive, followed by 90% East Division and South Division, because East Division is also having many unauthorized and settlements, and Central Division, which is almost the which covers the NDMC area. The number of fire incidents is much less. We have mobilization of DFS resources. We have a centralized mobilization. Fire control room is situated at headquarters, Connaught Place. We have independent wireless communication. Total emergency fire telephone number is 15. We have a PCR hotline, special risk hotlines like Delhi Metro Rail Corporation, IGL, and Air Traffic Control. We have a direct hotlines with them, and also we are on ERS system with Delhi Police. Mobilization, we have already categorized the fire incidents, and as per the category of the fire incidents, we mobilize our resources and officers. As you can see that the category 12 serious fire incident can have 29 to 35 fire tenders with the operational command control with the chief fire officer. So we have our mobilization as per these statistics. As is the Delhi Fire Service, we have got a fleet of many fire appliances like water tender, water bowser, motor pump, foam tender, ambulance, hydraulic platform. So this is one of the hydraulic platform, and this is the picture taken from a rescue of a patient during a hospital fire, which becomes the headline of a newspaper, that during a we use this hydraulic platform to rescue patients from the upper floors. Hazmat van at 3 disaster management center. We have a Hazmat van, which can be used for chemical and biological and other incidents like this. And dry chemical tender, we have got rescue tender for road accidents, and the equipment used are very useful for rescue and person trapped in under debris. We have water bowser in many areas where the water scarcity is there. We use water bowsers to feed these small water tenders. So are being also conducted at different occupancies where Delhi for creating fire safety awareness amongst people. Special fire mock drills and live demonstration also from time to time and during fire service week. These are some of the photographs of the mock drill exercises we have conducted. Now, I will come to the life safety part. Life safety provisions that are necessary to minimize danger of life from fire, smoke, fumes, panic in the event of fire and similar emergencies include construction and occupancy features. So if the building is constructed as per plan, then there are less chances that number of deaths during an emergency is going to happen. fire safety is concerned, we can divide fire safety into two major heads. One is fire protection and one is fire prevention. Fire prevention is better than cure. Prevention is always better than cure. So fire prevention is nothing but the practices or culture. And fire protection head, we have got passive fire protection and active fire protection. Fire protection is the elimination of minimizing the reason that leads to starting of unwanted fires. And fire protection are the components and guidelines for selecting the correct type of equipment and installation meant for fire protection of a building that includes sprinkler system, hydrant, hose reel, etc. etc. We have conducted a study in which we analyzed the 4 years data in the Southwest Division of Delhi, and as you can see that the number of fire calls are maximum in the month of May and June and minimum in the month of February. So during the fire this summer season, the number of fire calls are very much higher. So we need to take higher precautions, particularly in Juggi clusters and these unauthorized settlements, so that the number of fire calls and number of to fire remains less. Incident, if we see that residential fire, receiving most of the fire calls in residential areas. As far as other occupancies, educational, institutional, assembly, business, and the second number is the mercantile occupancies like shops and shopping areas. And non-structural occupancies in vehicles, fire in ground, fire in open areas or etc. They also constitute nearly 47% of the fire calls. So in building fire, as far as buildings are concerned, the residential maximum number of fire calls are receiving in the residential companies. And what kind of material we are receiving, what kind of material are involved generally in these fire cases? Electric meter board fires, transformer cables, electric wire, cooler and AC. So if we, from these statistics, we analyze that if we prevent the fires, if we want to prevent fires, we have to take care of our electrical wire system, electrical wires, electric meter board, transformer cables, and AC, etc. Other one is the non-electrical fire incidents. In-house articles covers 20%. LPG involving LPG is having 8%. Vehicle fire. Now this is a very interesting thing that these days CNG, we are using CNG operated vehicles, and the almost 12% of the fire calls are attributing to vehicles. Fire and life safety legal requirements. If we want to enhance our preparedness, if we want to mitigate the measures, and if we want to have better resources, so we have to be in accordance with the law. And Delhi Fire Service has one act called Delhi Fire Service Act of number 2 of 2009, and we have got Delhi Fire Service Rule 2010. And for building construction and other parameters of building, we have Unified Building Bylaws 2016, and earlier, before that, Unified Building Bylaws, we had Building Bylaws 1983 and Fire Protection Arrangement as per the National Building Code, Part 4, Fire and Life Safety. These are the classes of occupancy which are likely to cause a risk of fire. These are the occupancies which are defined in Delhi Fire Service rules. They need fire NOC. Delhi Fire Service rule, I will not go in details. You can find the Delhi Fire Service Act on our website. It is available. And these are the 20 points which we generally inspect and see that access to building, of exits, protection of exits, compartmentation, smoke management system, fire extinguisher. We go and check on these parameters. These are the 20 parameters which make the building safe in case of any untoward incident. If these things are provided and working properly, then we can save many lives. Now, third part, geospatial technologies like GIS and GPS and a modern communication system can significantly contribute towards the efficiency as well as effectiveness of fire service during an emergency. And we are using some of these technologies. Geospatial technology, it supports planning, preparedness, mitigation, response, and incident management. It extends the ability of maps, intelligent interactive maps. I will show some of these maps to you. During study, we have used these maps to make the picture very clear. More important, GIS provide the required information when, where, and how it is needed. So, one of the picture we have depicted the 10 fire station where we are receiving majority of the fire calls, and in this picture we have demonstrated the fire station location and a 3 kilometers buffer. So we can see that the how far the other areas which are away from the fire station. So we can plan, suppose this is a big area and we don't have any fire station in this location, so we can plan a fire post or new fire station in this area. Shows the major fire has happened, like Make 4 happened in this area. This is Dwarka, this is Najafgarh, and this is Rajendra Place, and this is the Janakpuri area. So these are the water reservoirs where we can take waters. In case of major fire, we can tap water from that. And water supply areas, Delhi Jal Board provides the maps where they are providing 6 to 8 hours supply in a day, or where the water supply is more than, and where the areas which are not shaded is the areas where there is no water supply. So these interactive maps can help in disaster situation in a long way. One of the severe fire incidents, we have plotted the severe fire incident over a 3 years period from 4 years period from 2013 to 16, and we find that the this area which I am showing you with the pointer is a Dwarka area, and you will not find that many of the severe fire cases, none of the severe fire incident happen there. And this is the light yellow shaded area is the built up residential areas, and these are the areas where we are having maximum number of big category fire calls. There is a scarcity of water, there is a encroachment, the access to the fire ground is not there. So we find many problems in this area. This is the industrial area of Mayapuri, and these are the Rajendra Nagar area where we have big multi-storied buildings are there. So by plotting these maps, we can find the where and where, when and where our problem exists lying, or we can help in improving the situation. Risk assessment, we have conducted a risk assessment, and in the areas of division, and you can see that this zone or this area receives the maximum number of fire calls. So using these technology, GIS and GPS, we can it can be very helpful in deciding the location and where our resources are to get the best use of it. As the latest modern equipments are concerned, we are in the process of procurement of new remote control firefighting vehicle, articulated water tower procurement, and Delhi Fire Service has procured a drone for surveillance purpose. I think the Delhi Fire Service is one in India to have a drone for fire services. In the last, I would say that we should prepare fire safety, identify hazard, consider who is at risk, and we should keep our means clear, because we have found that the people, we generally found that people are at the locked exits. Many fire incidents happened in the low low-rise residential building like still +4, and when fire occurs, there is one available escape staircase is only one, and when they move to the upper side of the terrace, they found it locked and they got unconscious and got killed. So we should keep our alternate exits clear of obstruction, and we should plan our alternate exits. We should train ourselves, fire safety training, hazard prevention methods such as good housekeeping and culture. And training should also include how to operate a fire extinguisher. I have seen many people, I have interacted many people who have served 30 to 40 years in service, but they can't operate a fire extinguisher. Fire extinguisher is generally provided in every area to extinguish a fire which is small in the beginning. But if you don't put a fire extinguisher or put out a fire, then it grows with time. Thank you very much.
Thank you very much, sir, for your wonderful presentation. Uh, if anyone has any question, you can ask. You can raise hand. I don't think so. So, thank you very much, sir, for your wonderful presentation. And you rightly said that prevention is better than cure, and we need to prepare before the incident happen, and that's the main objective here. Thank you very much, sir. Now I move ahead with our technical session. I request Mr. Ashish Kumar Panda, sir, for his presentation.
Okay, Shilpi ma'am.
Yes, sir.
I think Dr. Jugal Kishore sir is waiting. I think we should
Okay,
give
okay.
sir first chance.
Sure,
and
sir. Sure,
I
sir.
will come later. Yeah.
Okay, sir. So I request Dr. Jugal Kishore, sir, for his deliberations. Professor Dr. Jugal Kishore is a director, professor, and head of Department of Community Medicine, Vardhaman Mahavir Medical College and Safdarjung Hospital, Ministry of Health and Family Welfare, New Delhi. He did his MBBS and MD from AIMS, New Delhi, and PhD in psychiatry from Delhi University. A fellow of Indian Association of Public Health, fellow of National Academy of Medical Sciences, fellow of International Medical Science Academy, fellow of Indian Association of Prevention and Social Medicine, fellow of IMAMS, fellow of Indian Society of Malaria and Communicable Diseases, Indian Association of Adolescent Health, and Indian Academy of Social Sciences. He is also a member of more than 15 professional organizations. Professor Jugal Kishore authored more than 250 scientific and journal papers and more than 22 books. He is a recipient of more than 10 awards for his social and academic work. Sir, over to you for your presentation, please.
Thank you very much. Nilesh, please allow me to share the slide.
Yes, sir. Just a minute.
Thank you, Ashish, inviting me for this presentation.
Yes, sir. Now you can share.
It is always an honor for us, sir, to have you here. Thank you, sir, for accepting.
Yeah, you can see now.
Yes, sir.
Okay.
Visible, sir.
Yeah, topic given to me is emergency health management in Delhi during COVID-19. So my focus would be on COVID. I'm not going to change my topic on other disaster which has been there. I think they have already elaborated on the fire safety and the fire management, but as in the inaugural address, it has been pointed out that West Delhi, rather Delhi is moved to manage the COVID, and because the COVID has created a kind of disaster which is beyond any kind of disaster, because the impact is huge. Impact on the population is quite big, which is much bigger than you can say the earthquake or flood or maybe some other which you can say, where whole country is involved, not just one small area. Therefore, I'll just focus on that how Delhi has managed. Delhi, if just focus on the kind of biological disaster has occurred in the history, we have a number of diseases which has created whole world panic, and that is starting from way back in. Rather, there are few diseases which are there in even time of Buddha and beyond. But whatever literature we have, it's showing that the plague is the one which has which has given a lot of trouble to the mankind, where millions of people died over a period of time. You can imagine some of the pandemics has occurred in 100 years. That's a very big. So you can imagine that how the people have come out from those all years of suffering. We have the Black Death. Again, the word quarantine has come from these kind of pandemics. All kinds of measurement which we are adopting today is already experimented in various pandemics. For example, the Spanish flu, which was there in 100 years back, where one third of the total population of the world get affected and many millions people died. So there we have developed this all measures of sanitation and mask and all these things. But beside that, smallpox and plague and cholera, we have pandemics throughout the world affected larger population. Is a leprosy and tuberculosis. Today, we have these diseases, but very less. Only the smallpox we are able to eradicate from the world, but rest of the diseases are there, but not in that manner. And there are many reason for decrease of those diseases in the population. Now, when we talk about Delhi, there are instances of hepatitis, which has been called as the classics of the hepatitis investigation, which was done by the R. Vishwanathan, and it was published. It has detailed elaboration that how Najafgarh Nala has polluted our river, and which is supplying the water supply to majority of the areas. So such contamination has been pointed out, which lead to epidemic or outbreaks in Delhi. Similarly, you are all witnessing that how dengue hemorrhagic fever and dengue shock syndrome over a period of time affecting. The outbreaks are very common, and whole Delhi gear up to improve its management as far as the health is concerned, or the municipality sanitations and all these things are concerned. So over a period of time, we have various viruses coming and disturbing and causing the kind of outbreaks in Delhi. Then we have the H1N1 pandemic, and Delhi was greatly involved. And you can imagine that it was started in 2009, but continue in various forms, and that's also continue until 2015. If we see some of the trends, then we can find that yes, we had the in 2015 is much higher the swine flu as compared to 2019 at the time of pandemic. So it's pandemic is now continue when we talk about this H1N1. Now, when we talk about this COVID, now you just look at it, Delhi, which is similar to any major city like the Mumbai and Chennai, where continuously after the notification that India can have the COVID or say the SARS-CoV-2 vaccine, co-virus 2, that is also known as COVID-19 disease. After the March onward, we continuously having increase in the number of cases and deaths. What we are seeing that lockdown has delayed the occurrence of spikes, but just after the release of the lockdowns, every lockdown relaxation leading to a kind of spike in Delhi, which was not witnessed in other, which can be easily understood that how transmission lead to spikes. Now this structure of virus is quite clear. Now it is RNA virus, and we have various kind of viruses like alpha, beta, delta, and gamma, and the beta is a major cause of the concern. And this mutation occur in this this coronavirus, which led to type 2 virus, type 2 mutation, and which lead to. But as the reproduction occur, it is found that minor variation keep occurring and mutation keep occurring. Every month we have one or two mutations and the new virus emerged. The basic structure of the COVID remains same, but the spike and their entrance into the cell, the capacity of these all things changes, small changes, making them more infectious or maybe less lethal, so they can be part of the population and can survive longer. So such kind of modification keep occurring in the virus to remain in the population. This is the way the infection transmit. It is from the susceptible to the infected to susceptible person, and then more people. So you can see that 2% infect 4, and then 4 is 8, and then it is an exponential type of infection rises, and this is denoted by R0. So in Delhi, because the population is quite densely populated, that is why the transmission is quite high as compared to our rural or some other cities. Therefore, the number of cases in Delhi from the very beginning were very high. It continues to be the leading and remain cause of the deaths because of the COVID. The symptoms are similar to any flu, except the one or two variation. In our study, we found that the symptoms are not different from COVID positive and non-COVID positive. The pain and chest pain, fever, or cough are similar, except if the person is having the history of COVID positive connection or the contact with the COVID positive. That is a most important significant finding. We got it that if you have that history, you have more chances of COVID positive, or you are working in hospital where COVID patients are there, then you have more chances of COVID. Otherwise, symptoms are not leading to a kind of special COVID symptomatology. Now, everybody knows that in Delhi, as soon as we had this virus came through our our airports and particularly airports from the foreign, then infection started spreading in Delhi, and some areas were more involved. And we had developed a diagnostic facility in major hospital like the RML hospital and Suffolk Hospital and AIMS. And then it is spread to other part, like Delhi government has many hospitals. So after a few weeks, we start testing, and within a month's time, we have developed the capacity of testing the virus. But unfortunately, not major treatment were available. Antiviral drugs are not there. Whatever experiment were done, by AIMS or by Delhi government and other, we found that not very good treatment is available, except vitamin C or zinc, or maybe I think plasma therapy. Later on, plasma therapy was also found not very significantly improving things. So the supportive treatment was a major things which was advocated in this. And Delhi adopted following strategy, preventive strategy, which are there in the world. So the Delhi administration play a very significant role in managing the whole pandemic. We can see that immediately the Epidemic Disease Act was enacted, or was amended and enacted immediately. And then international entries were checked, screening was done, surveillance was placed, the outbreak investigation started, the contact tracing and surveillance was the major issue, and which has been taken up by the Delhi government. The risk communication in the form of the IEC and other things were immediately carried out. As far as the community involvement is concerned, I think that not much is done in Delhi. But definitely the data was collected, but slowly it was improved. Initially, there was some gaps in death rate and all these things, but later on they were all streamlined. The surveillance program which we have, the IDSP, is also improved. The TRI system is very well done. We divided all hospital into the red and green and yellow. So the patients were shifted to according to the pricing, and isolation was done on the basis of price. The quality of care was very important, and therefore the individual hospital are totally dedicated to COVID. So the improvement of their treatment can be facilitated, and other people cannot be were not involved. So there were less chances of transmission of infection. The dead body management were also done very well. But as far as the mental health and counseling and stress management is concerned, the services come very late. But this is the airport. Immediately after the notification, the screening at the airport started with the help of central government. Similarly, at the bus stops also we had this screening for the COVID. The lockdown was done and it was implemented in a very strict manner, and we witnessed that whole 2 weeks, almost 1 month, we had no transportation at all. Later on, the contact tracing was started by our health workers, and then ambulance system were in place. So whenever we had the positive case and he is symptomatic, he was transferred to the isolation centers which are designated. So Delhi play a very important role in managing these all things. They defined the containment zone and they designated all these containment zone. Similarly, the contact tracing was done in the contact zone, and also otherwise also the zero surveillance zero survey was done, and it was done very I think the first zero surveillance was conducted in Delhi only, and then we had the 3 zero surveillance, so giving the true pictures of what is happening in Delhi as far as the infection is concerned. And then strict norms were launched by involvement of the Delhi police. If anybody violating any kind of norms which was given by the Home Ministry. So these are all COVID fight measures which has been implemented in Delhi. Immediately quarantine center were established, and then hostels and health facility and buildings were made quarantine centers where all facility were available. And later on, when there was possibility that we were not having enough space, so the home quarantine was also allowed. So that makes the flexibility in managing all kinds of patients. So the quarantine center, which was established, done by Delhi government only, with the help of the central IT BP camps or military, and the facility was high quality services were provided by Delhi government. Then later on, the isolation ward were made again with the help of central government, but there the ventilator were also available. So that was a big movement done by the state government, Delhi government. The key messages were also time to time were issued by Delhi government. Even Chief Minister has come forward and spoken many times and given direction to all groups of people for their support. You can imagine that how each areas were monitored, and the police were directly controlling those areas. So that was actually maintaining the social distancing or physical distancing, so the transmission can be limited. That is a very important part in the COVID management. Trials was very mild and moderate and severe. So we have the COVID care centers, then we have dedicated COVID health center and dedicated COVID hospital. All 3 categories of hospital were there in Delhi. At the same time, the railway also pitch in, and they also make available some of the facility which were not used much, but they were all helping Delhi government. This was a big problem arise in Delhi, where when not only Delhi but whole country was there, but Delhi witnessed so much migrant population which was migrating, and we had the problem of feeding them because lockdown created such kind of situation where the people were not having food. So Delhi government immediately supplied those all things and made a good arrangement in schools and otherwise. This is the kind of preventive measures they have advocated and shown on the TV and in all the places where they have advocated the hand washing, the cuffing etiquettes, wearing mask and avoiding human contacts. And then, the toll-free numbers were available where they can contact them. And then, a depiction by pictures showing that how much distance is required in between the two. But the major information given by Delhi. The management of dead body was also done very well, and then sanitization of the colonies and the wards are also done, and buses later on also regularly sanitized. So they are good measures, I can say, in civil society. This has been done. So because of that, the India is now going down in the trends of decreasing the epidemic. The epidemic curve is already gone, and now we are in sliding terms. So death and new cases are going all down. And if you see at the Delhi, so the three peaks which has been witnessed after the lockdown and the festive season, they are also now going down. So in nutshell, the Delhi has very well managed this pandemic in proper manner, and Delhi is now gear up for the vaccination. They have identified 51 lakhs Delhiites in the first round to vaccinate the healthcare workers and frontline workers, and the training is started. Large number of our doctors and nurses has been trained, and they are in process. And maybe I think in week 2 we are going to start the vaccination. So I can say Delhi have played a very significant role in controlling this COVID as a part of the pandemic in the world, and witness that we had the large number of cases, but the fatality in Delhi remain very low, which is recommendable job. So thank you very much.
Thank you very much, Dr. Jugal Kishore sir, for this amazing presentation on how we manage the COVID-19 situation in Delhi. You explained it very well. Thank you very much, sir, for your time. Now, moving ahead with our next speaker, I request Mr. Ashish Kumar Panda, sir, to kindly deliver his talk. Mr. Ashish Kumar Panda is faculty ECGRM Division at National Institute of Disaster Management, New Delhi. He is a Central Secretariat Service Officer with an MBA in Disaster Management. He is pursuing PhD in Climate Change field. He has more than 6 years of experience in working in Disaster Management Division of MHA, and he has joined NIDM as faculty member in September 2019, and presently looking after the Center for Forestry, Biodiversity and Animal Inclusion Disaster Risk Reduction. Sir, over to you for your talk.
Thank you, Shilki. Kindly allow me to share my presentation.
Yes, sir. Done, sir.
I hope you can see it now.
Yes, sir.
Okay, so thank you very much for giving me this opportunity after two wonderful talks of Dr. Sanjay Tomar sir and Professor Jugal Kishore sir. And Jugal Kishore Saab has wonderfully covered most of the aspects of COVID-19 in Delhi specifically. And 3-4 important points I wanted to bring to the forum with respect to disaster risk resilience. The first one is COVID-19 itself. Most of the points has been covered by Professor Jugal Kishore, but quickly I will cover 2-3 slides over that. Globally, as we know, we have reached 7.97 crore cases, deaths to the tune of 17.49 cases, and recovery 5.61 crore. If you see the closed cases, this ratio of recovery and death, this is 97% to 3%. As far as India is concerned, we have crossed more than 1 crore cases, 97.17 lakhs of recovery. Recovery, if you see globally, if we compare, then we are recovering in a better fashion, as rightly pointed out by Professor Jugal Kishore sir. We have 1.47 lakhs of deaths, and we are doing 7,319 cases against this 7,319 cases per 1 million. We are doing 16. We have done 16.63 crores of tests till date. And if our ratio, Indian ratio of this closed cases, if you see, this is far better than globally. This is 98.5% with respect to recovery to 1.5% with respect to deaths. As far as Delhi is concerned, specifically, we have crossed 6.2 lakhs of cases, but recovery rate is very good. 6.02 lakhs have been recovered with 10,384 deaths. Recently, we have crossed this 10,000 marks. This mortality rate is even then it is very, very less compared to other cities as far as India is concerned, and global ratios, if we see, we are far below. And 4 phases of 2,500 deaths, if we bifurcate this 10,000 deaths into 4 zones of 2,500 deaths, this is one area of worry, because first 2,500 deaths we require 106 days to reach. Thereafter, the days started reducing by 86, 54, and 29 respectively. But as rightly pointed out by Professor Jugal Kishore sir, that active cases are declining in the past 9 to 10 days in all districts of Delhi. It is less than 8,000 right now, yesterday's figure. 7 out of 11 districts in Delhi, they have recorded less than 1,000 active cases on December 22nd. It is again reducing, despite increasing number of RT-PCR tests. So we are doing more tests of late, but we are finding less positive cases in that. Positivity rate is 1.18% only. If you remember distinctly the third wave time, this is November phase, this rate was to the tune of 15.34%. So reducing from 15 to 1%, that is very, very positive side as far as Delhi is concerned. As far as vaccination is concerned, sir pointed out that 4.2 million population aged over 50 will be provided vaccination first. Below 50, only with comorbidity cases. Then we are going to provide 0.6 million frontline workers the first vaccine dosages. As far as medical fraternity is concerned, 0.3 million people will be benefited. We have a storage capacity of 7.4 million doses, but again, as Kejriwal sir recently he quoted day before yesterday, that within 7 to 8 days time, our capacity is going to increase to the tune of 11.5 million doses capacity. That registration has already undergone since the month of October 2020. The national digital platform, that is COWIN, COWIN, that is being used by the Delhi government for this registration purpose. We are providing training to more than 3,800 persons with respect to gaining that vaccination team, where there will be 5 persons. Their job will be to provide 100 vaccination per day. Delhi High Court has recently given a verdict that we have to reduce the number of ICU beds in private hospitals, which was kept at 80% ratio. This has to be reduced to 60%, so that non-COVID patients can also be given proper attention as far as Delhi is concerned. Our air flights we have cancelled with respect to UK because of that new strain that has been found in UK. Till 31st of December, the flights to and fro from UK has been suspended, despite the fact 2 UK returned passengers recently, they fled to Punjab and Andhra Pradesh. They should not. People who have been detected with new strains of viruses, they should not do these kinds of activities. They should provide themselves to the authorities so that they can be checked and treated properly. So new isolation unit is being developed at LNGP and Sardar Vallabhbhai Patel Quarantine Center. We are moving very fast with respect to that. As far as Delhi Airport is concerned, a special corridor is there with respect to foreign returned passengers, so that we can expedite immigration, custom and baggage clearances there. So we don't need to worry about that. So as far as COVID-19 is concerned, we have to basically flatten the curve. We have to break the chain. We have to keep social distancing to the maximum extent possible. We need to work from home. We can learn new things, new skill development and things online. We have to be cautious. That is very, very important. But we need not be panicked with respect to this pandemic. we can donate and help needy persons. Because of this, most of the people losing their jobs in present times because of that economy loss. And we can help stray animals in these times of COVID. We can help stop spreading rumor mongering is very, very important with respect to not only COVID but any kind of disaster. So we have to be very careful. Only authentic information we should collect from the authentic resources, and then only we should keep on spreading these kinds of positive news only. We have to fight the disease. This is very important. We should not fight the patients and corona warriors in this regard. We need to learn to live with pandemic, because this new strain finding in UK, and one UK doctor has been quoted as saying that forget about 2021, probably by 2030 we will still be living with these kinds of new normals, like this masks and this social distancing and things like that. So we have to learn to live with pandemics hereafter. And last but not the least, we have to pray for others while we are praying for ourselves, for our near dears, our family people. So this is first part of my presentation about COVID-19. See this beautiful picture of this India Gate in the times of lockdown. Because of this lockdown measures, that our skies were very, very clear, and this air quality improved like anything. If you remember 2014, WHO declared New Delhi as #1 polluted city. Their usual air quality index here is more than 200. At peaks, it even reaches to 800, 900. So 200 itself is 25% above unsafe level as deemed by WHO. But during lockdown times, this air quality index ratios reduced to 60, 40, 20 a days. But as we started easing over this lockdown phases and starting opening lockdowns, then again this air quality index has been improving like anything, reaching to very hazardous levels. In the coming slides, I'm going to show that. So it has become presently a very toxic state, severe zone, and AQI level has been reaching beyond 400 as far as 24 December and onwards is concerned. Areas like RK Puram, ITO, Bhavana, Alipur, Rohini, Okhla Phase 2, Anand Vihar, it is more than 450 even. That is very, very dangerous for human health. So this is because of slow wind speed, that is accumulation of pollutants. There is one concept of inversion rate. See, in the winter, when there is very much cold, and because of this slow wind speed, this inversion rate, that is the area in the atmosphere where these pollutants can grow, can move up to. So in normal times, when this is not winter, when the wind is proper, pollutants can go up to 3-kilometer height. But because of this winter season and slow wind speed, this height is only 800 meters. So this dense, this fogginess, haziness in the atmosphere, that also creates some crisis with respect to not only pandemic but also common major health issues. So this has been quoted as a public health crisis as far as WHO reports are concerned. There is a Commission for Air Quality Management now. Earlier there used to be Environment Pollution Prevention and Control Authority. So probably we can think of a better future as far as Delhi is concerned in future times. These are two reports from, one report from Lancet Planetary Health Report that came out on 21st December 2020. One section, it talks about the India State Level Disease Burden Initiative. It says that 18% of total deaths that can be attributed to air pollution as far as India is concerned. It also accounts for 1.4% GDP loss in India, that is to the tune of 2,60,000 crore of rupees. And 4 times this is healthcare budget of our this fiscal 2020 and 21. So we can very much worry about the kind of situation we are living in, and not only the economic loss but the health losses that we are facing because of the air pollution. We have to be very, very worrisome with respect to that. So as far as the chronic air pollution is concerned, it can probably lead to more COVID deaths also. One global research says that more exposure to chronic air pollution, then more chances of succumbing to COVID, because it generates oxides of nitrogen. It is dangerous like particulate matter 2.5 as far as size is concerned, and also it creates ozone in the atmosphere that is very, very dangerous with respect to our health. And our fuel industry, our industries that are very, very common in the Delhi and suburb areas, that NCR areas, they omit NOx. And Paris Agreement says already it was launched in the year 2015, and already 5 years have gone, and probably we have lost more than 1 million lives with respect to air pollution. So we have to rejig our cities for more public transports. We have to go for non-motorized transport, invest in clean industry production, probably that is going to help our climate change issues as well. So we should move in those directions. So some reasons if we cite for Delhi, as far as Delhi is concerned, then because of this change of wind direction, October onwards, with the withdrawal of the monsoons in the northeast West India, and this direction goes to northwesterly. Probably the direction of the wind is northwesterly in summers for some time also. That brings dust from the northern Pakistan and Afghanistan area. That is also one of the reasons why we are having too much of this air pollution in those times. Then reduce wind speed in the winter. High speed winds are very effective as far as disposing pollutants are concerned, but as far as winter in Delhi is concerned, it brings dip in wind speed overall as compared to the summers, which makes the region prone to pollution. And also Delhi is landlocked from all over side. It is landlocked. There is no sea, no mountains. So it doesn't have that kind of geographical advantage as our northeast people enjoy, as our Uttarakhand people enjoy, or our coastal area states that they enjoy. Then one common problem area is stubble burning that Punjab, Rajasthan, Haryana, we blame them for causing a thick blanket of smog in Delhi during winters. Then gases like methane, gases like carbon monoxide, then volatile organic compounds. These are very, very dangerous. Carcinogenic polyclinic aromatic hydrocarbons are also emitted during this stubble burning. That is very, very dangerous to our health. Then vehicular pollution. It is one of the biggest causes of dipping air quality as far as Delhi is concerned. And again, in winters, when people avoid public transports and they try their own vehicles, and around 20% of particulate matter, 2.5 winters come from this sector, vehicular pollution. Then we also face dust storms from Gulf countries. I talked about northwesterly direction of wind during those times. So dry, cold weather means dust is prevalent in the entire region. I talked about the inversion rate, and dust pollution contributes to about 56% of particulate matter 10. And as far as particulate matter 2.5 load is concerned, that is very, very magnificent quantum that is contributing to air pollution as far as Delhi is concerned. Then dip in temperature. As temperature dips, the inversion height, I talked about that lows, and that is very, very important aspect, so that the pollutants get densed in that 800-meter area, and we face air pollution in Delhi. Firecrackers also, despite the ban, we always find firecrackers in Delhi with respect to some festivals, with respect to our occasions like marriage and issues like that. This is also probably not the top reason of air pollution, but definitely it contributes to the buildup of air pollution in Delhi. Then construction activities and open waste burning is very, very important. Large scale construction in Delhi and NCR is increasing dust and pollution in the air. We also have landfill sites. I live in Vaishali, Ghaziabad area. There is Gazipur area. If you go and see, the huge mountain of this landfill site is there. We are dumping waste, and also we are burning waste in those areas. That also contributes to the air pollution. We have our Air Act 1981, which governs the air pollution system in our country, but the legislation have never considered health as a priority area in policy planning while framing regulations for combating air pollution. Also, we have pollution control boards, but they are unable to fulfill their mandate as watchdogs because we have not provided teeth to them. They cannot penalize people with respect to violations of this air pollution. Then our population liability regime, pollution liability regime has never prioritized the adverse impacts of pollution on health. So probably this is time that we should provide our pollution control boards more power to declare public health emergencies in the case of toxicity as far as air quality is concerned, more power to temporarily shut down all polluting activities. The changes might introduce an additional burden on industries, but they will proactively check their emissions if those standards are maintained, if those norms are maintained by PCBs. It is going to be very good as far as disaster resilient society with good health in future is concerned as far as our Delhi NCR area, if we are going to talk about. Then presently these boards cannot levy penalties, that they should be given that power. Then possibility of paying compensation would be a strong reinforcement for polluters to adopt cleaner technologies and comply with the standards. Then causes of air pollution can be multifold, and several agencies and ministries are involved. This is a multi-hazard scenario. So all these stakeholders should be brought into at one platform so that they can talk to each other, they can make policies which help all the stakeholder departments, whether it's government, whether it's non-government agencies, private firms, everybody should come forward so that we can control pollution accordingly. Then accountability and deterrence are very, very essential in making sure that polluters comply with emission standards. So these are few way forwards as far as air pollution is concerned. We have to bring more public transparency in these systems, which is essential for our war against the air pollution. Then if we involve citizens, they can be the best watchdogs. We can make pollution targets public every year so that it can be compared with the previous year targets, whether we have been able to achieve those targets or not. And then people will come out and will force the authorities to implement the policies in a proper manner. Breathing clean air is a fundamental right of every Indian citizen. So therefore, human health must become a priority sector, priority area when it becomes to tackling air pollution, making policies with respect to that. Then public transport in Delhi is very important. The current public transport system is probably disintegrated. We need to make it reliable, comfortable, and provides last mile connectivity. That's very, very important, but without additional cost. And people don't want to pay that much for public transport, but they want the last mile connectivity. We have to honor their sentiments with that. Subsidy that is given to the personal vehicle users make personal transport comparatively more affordable with respect to public transport. They start from their home, they reach their destination, they come back to their home very easily. So probably we need to go for more parking fees, more minimal charges for using the roads with respect to enhancing the cost of congesting the roads. If we align these kinds of issues, then probably people will move away from using personal vehicles, buying personal vehicles too much, and would rely on reliable public transport systems as far as Delhi is concerned. Probably that is going to help us like anything as far as moving towards a cleaner air regime in Delhi. Then open burning of municipal solid waste and industry. That is a very important area. We need to build institutional capacity for implementation and enforcement with necessary legal backups so that it can be complied with, and then strong deterrence should always be there so that people fear. Like this transport sector, we have enhanced the penalties. So you can see the graph, the erring people, that number of erring people, erring population that is going down. So these kinds of deterrences is very, very important with respect to forcing the common public to follow the rules. Now, another important aspect with respect to pandemic is cybercrime. This is enhancing as far as this pandemic, this phase is concerned. As far as this Delhi Police crime branch is concerned, cybercrime cell is concerned, they have reported that 33,000 cases were registered till November in this pandemic time during this year. During May, it was the highest. Daily 135 cases of this cybercrime were reported. The concerted efforts by cybercrime unit of Delhi Police to raise awareness, sharing case studies on radio programs, then providing short videos in WhatsApp groups, that is being very, very useful for the common public. That this spike is due to the increase of online shopping. People are not trained to do online shopping that much, but they are being forced to do online shopping because of this COVID times, because most of the times during lockdown, the markets were not open. So we have seen these kinds of cyber crimes. Then bogus sites have been reported with poor credibility in this pandemic phase. Then there is possibility of street criminals who are not being able to now do crime so easily on the roads and in the public habitat areas. So probably they are migrating towards online frauds. And then objectionable content, that is also one area of concern on social media platforms. And this crime cell had to ask Twitter, Facebook, Instagram, and TikTok and YouTube kind of social platforms to delete no less than 278 accounts by in the times of this pandemic. So cyber crimes also gets an enhancement in the times of pandemic. So this is one area with respect to urban resilience and disaster resilience, and this should be given proper attention to. Now, mental well-being. This is very, very important aspect. This last slide.
Okay, sir.
Last slide only. Yeah. So mental well-being is one area. This is very, very important with respect to pandemic. Howsoever rich we are, howsoever connected we are, and whether we are being in the government sector, our jobs are not going. Despite the fact everybody who is facing the pandemic is going into mental stress. Then in Germany, studies have been done by Carl Suhe Institute of Technology and Central Institute of Mental Health. The disastrous impact of COVID on public life as well as social relations and fabric of society has been studied in these two reports. And only in Japan, if we talk about in October, there were more than 2,100 suicides, which is more than the COVID deaths as far as Japan is concerned. So depression was already a crisis. WHO has declared is a pandemic kind of a thing before the pandemic, but it has become more fatal if you put together this stress with the pandemic crisis. Not only economic slump, but because of the post-COVID depression, people are committing suicide. So every year, global 8 lakhs people suicide, and as far as India is concerned, this figure is close to 2 to 3 lakhs per year. So this is one area of worry. So if you talk about National Crime Research Bureau 2019 report, then per day 381 suicides it has reported in 2019, and 2020 this figure has enhanced by 3.4%. So we need to give proper attention to these aspects. If we talk about our lifestyle as far as metro cities are concerned, 80% happiness is there, 20% sadness is there in generic. But what we do, we see these 20% look as if this is 200%, make our life worse. So this speed stair walk, this is one aspect, one thing that has been suggested that reduces your space, because it keeps ourselves alert, it keeps our energy level at high level, which is food to good mental well-being. Lots of research and development is needed in this area, and documentation, standardized tools, monitoring that is required, workshops, regular mock drills with respect to mental well-being is concerned, that should be provided. Social stigma that is attached with respect to mental health care, that should be removed through awareness. Then our work should be productive. Skill development we can do at our homes. We can go for charity, we can go for spirituality enhancement, we can help others. And then if we talk about, this is my last comment, that if we do the analogy of our life with respect to our trees require 3 important aspects: roots, trunk, and crown for their substantial and sustainable development. So that way, if we treat our life, the roots can be connected to connection to the divine, that is spiritual awareness. The trunk of that part of tree can be connected to our life with respect to cultivation of emotional and physical wellness. We should not give our remote control of happiness and sadness to others. Last, that crown of a tree, that is related to contribution, what we give back to the society. The purpose of our life should be life of purpose. So with this, I end this talk. So thank you so much for giving me this opportunity. Over to you, Shilki.
Thank you very much, sir, for this very elaborative presentation of yours. You talked about 3 major issues that we are facing in Delhi, that COVID-19 issue, and this air pollution issue. Every year this is constant, and still we are not doing anything about it. And this another issue is mental well-being, and this is also very critical issue to be looked into. And thank you very much, sir, for this amazing talk. Now I request Mr. Somendra Pal Rana, sir, Deputy Director, Industrial Safety and Health in the lab of Government City of Delhi. The speaker did BTech in Chemical Technology and Diploma in Industrial Safety. He also did PG DOS from ILO, Turin Center, University of Turin, Italy. Presently, he is working as Deputy Director, Industrial Safety and Health in Labour Department of Government of NCT of Delhi. And he has conducted more than 2,000 inspections and investigation studies, and enforcing the statutes were carried out by him during his 25 years tenure in the field of OSH. He visited various countries and attended conferences or seminars. He worked as labor inspection specialist in International Labour Organization in Bangladesh and developed standard operating procedures for Inspectorate of Bangladesh, apart from contributing towards framing checklists for inspections and other guidelines. He has also written many articles that are published by leading safety journals of repute. He authored a book titled Handbook of Occupational Safety and Industrial
Thank you very much, Shelby. Am I audible?
Yes, sir, you are audible.
Okay, thank you.
Now you can share.
So I am Deputy Director working in Labour Department in Government of City of Delhi. Welcome to all of you. We are basically enforcing Factories Act 1948 in Delhi. And this Factories Act 1948 provides this health, safety and welfare aspects in the factories for the workers, for the industrial workers. And apart from this, we are also enforcing the provisions of Building and Other Construction Workers Act 1996, BOCW Act, and BOCW Rule 2002. That is for construction workers, welfare of the construction workers. So this, what is the factory? Particularly factory is that manufacturing unit which employs 10 or more workers. That's all. Apart from this, others are establishments. And for this establishment, our labor department is dealing with that. Non-technical department is dealing with that, like minimum wages, payment of wages, and other things. And in this, we are carrying out inspections in different factories, and well-defined inspection procedures are there, and we are not carrying out motor inspections. Only complaint and reference-based inspections are carried out, and a timeline is also provided to carry out the inspections. And just a minute. Yes. So recently we have developed off-site emergency plan for NCT of Delhi. Particularly, I have developed the plan for District West, District Southwest, District Northeast, as well as District Northwest. So we have got 19 MH installations here, major accident hazard installations, where we are also carrying out the inspections and see whether the safety and health of workers are well in place and the compliance is being carried out or not. And apart from this, in the construction sites also.
Somendra sir?
Yes.
Sir, do you have presentation?
Yeah, I have presentation also.
Do you want to present it? I mean, I have given you presenter rights.
Okay.
Yes, sir. If you want to, you can present. Otherwise, you can present it this way also. It's your choice.
Just a minute, just a minute.
Okay, sir.
Let me find out the presentation.
Sure, sir.
How to start the presentation?
Sir, there's an option, share option, no?
In the share option.
Yes,
and
sir. Share screen. First, you open your presentation, then share your screen.
My screen.
Yes, sir. Yes, sir. It's coming. Make it full screen, sir. The presentation.
Okay.
Slideshow.
Okay.
Yes.
So this is the Factories Act 1948, which provides health, safety, welfare, and other aspects of in the factory. The act is enforced by state government, and this act is made by the central government. But the different inspectors are enforcing this factory through the factory inspections. And as I told you, 10 or more workers, if they are working in a manufacturing process with the aid of power operated machine, then this is called a factory, or 20 or more workers are working in a factory without the aid of power. Means if power is not being used, then this will be called a factory. And as far as the definition of worker is concerned, the worker directly or indirectly with the knowledge or without the knowledge of the principal employer, if he is working in a manufacturing process or any kind of work incidental to or concerned with the manufacturing process, it will be treated as a worker of the factory. And in the manufacturing unit, it has a broad definition: making, altering, repairing, ornamenting. Like if we are pumping something, pumping of oil, like in petrol pump, it will also be treated as a manufacturing activity. And breaking, demolishing, treating, adapting, or ornamenting, or generating, or transforming, transmitting power, or creating, or composing, it all comes under the purview of manufacturing process. So whatever manufacturing process is going on in any unit employing 10 or more workers with the 8 of power operating machine, it will be treated as a factory. And all the provisions of the Factories Act 1948 and rules made thereunder will be applicable to those factories. And the ultimate responsibility is given to the occupier. If something happens in the factory, who is responsible? We cannot hold the supervisor is responsible for any mishap or any kind of occupational disease or any accident. So ultimate responsibility lies with the occupier. So who is the occupier? Occupier is the person who has ultimate control over the affairs of the factory. And in case of private limited, any director, any one of the director can be an occupier, not the manager or not vice president or and any other person. In case of proprietorship firm, only the proprietor can be the occupier. In case of partnership firm, any of the partners can be the occupier. And other partner had to give the NOC to a particular person who is the partner of the company. These are the duties of the occupier. He has to ensure health, safety, and welfare of the workers, maintenance of plant and system with the provisions of safe and without risk of health, safe handling, storage, and transportation of particles or substance. Suppose something is transportation is also being carried out by the occupier, it is his responsibility. And provisions of information, instructions, and training to ensure health, safety, and welfare of the workers. There may be certain factories where hazardous process is going on or some dangerous operation is being carried out. So whatever hazard is involved with the substance or with the system or with operating procedure, all these informations and instructions has to be given to the workers of a particular factory. Safe, risk-free, and healthy working environment is to be ensured by the occupier. And general policy on health and safety of the workers. This general health and safety policy is to be framed by the occupier, which contains and deals with the objectives and targets of a particular factory. It gives the overall umbrella how to carry out the safe work and how they are going to deal with their day-to-day activities. Any factory which is working in any state, it has to get registered and license is to be granted by the Chief Inspector of Factories. So there are very nominal fees, and they have to apply for the Factory Act license, and they have to submit the building plan also. So in the building plan, we have to see whether the factory is having sufficient space for the number of workers for which he has asked for the license, as well as the machinery and all these things, cleanliness, waste disposal, everything we have to see before issuing the license to the person. These are the health related provisions like cleanliness, waste disposal, ventilation. Proper ventilation is required, dust and fumes, and workplace monitoring can be done to check whether the dust and fumes are within the permissible limit or not. Humidification, overcrowding, lighting, drinking water, latrine and urinals. These are safety related provisions like fencing of machinery, hoist and lift, lifting tackles, pressure plants, all these things, this hoist and lift, lifting tackles, pressure plant, competent persons have been nominated by these factory inspectorate, and they are recognized as competent persons, and they have to check hoist and lifting tackles and pressure plants like air compressor and air receivers, and they have to check every aspect of that, and they certify that the particular machinery or lifting tackle or hoist and lift are in working order, and then they give the certificate to the management. Protection of eyes, precautions in case of fire, test and stability certificate of the building. In case some building we carry out the inspection and see a building in a dilapidated condition, then we ask for the stability certificate from the management from a chartered engineer. These are the welfare facilities like washing facilities for storing and drying clothes, facilities for sitting, first aid appliances, canteens. Canteens are only applicable where 250 or more workers are working in a factory or employed in a factory. And shelters are also required in a factory where 150 or more workers are working. And crèche where 30 or more women workers, whether married or unmarried, irrespective of that, if 30 or more workers are there, then there is a necessity of crèche also, having certain facilities like milk and other things. Welfare officer is also required if 500 or more workers are there, and safety officer is also required if more than 1,000 or more than 1,000 workers are working in a factory. We have categorized the factories in broadly three categories. One is hazardous process, hazardous industries. Another one is a dangerous operation, and one is normal engineering process or something like that. In hazardous process means any activity or process in relation to industry is specified in first schedule. In the first schedule of Factories Act 1948, they have described certain hazardous processes like buffing and electroplating, polishing, and chemical plants. All these things we have covered in hazardous process. Section 41B of Factories Act 1948 speaks about compulsory disclosure of information. As I told you, in case of hazardous process, in these provisions, the occupier had specific responsibility to tell to the workers about the hazard associated with the process, plant, and other activities which are going on, because it may be harmful to the workers, or some occupational disease may also occur in that for carrying out this hazardous process. Specific responsibility is very well defined, as well as workers' participation is also made mandatory. Means this safety committee is also required in particular factory, where equal participation of workers as well as equal participation of safety personnel, means management personnel are required. These are welfare related provisions. Washing facilities, facilities for sitting, first aid appliances, and first aid trained persons are also required. Canteen, shelters, crèche, welfare officers. These are the special provisions. Dangerous operations, as I told you, one is hazardous process, another one is dangerous operation. There are certain dangerous operations which are laid down in a schedule in Delhi Factories rules and in model rules also. And notice of certain accidents and certain dangerous occurrences has to be given to the inspectorate and to the police and to the district magistrate. In case of some accident takes place and the worker does not come within 48 hours, does not come back to the factory within 48 hours, then next 24 hours, the management has to tell the inspectorate about the accident in a prescribed pro forma. These are the general penalty for offences for any factory if any contravention is being carried out, then it is punishable for a term which may be extended to 2 years and with a fine for 1 lakh rupees or both. These are different offences and penalties. Continuous offences, for continuous offence, 1,000 per day is a penalty. And on contravention of Chapter 4A, that is pertaining to safety and health, means hazardous factories. In case of death or something like that, 25,000 is the death minimum is the 25,000 fine. Liability of owner of the premises. As I told you, the liability of a factory lies on the occupier, but owner of the premises, it may be possible that owner of the premises may not be the occupier of the premises. The building may be given on rent. Then in certain cases, this liability of owner of the premises is also there, like common facilities, drainage system, approach road, water supply, lighting, sanitation, and access and lifts, etc. Because these are the common facilities. There may be possibility that the factories, the premises having 3-4 factories. One may be at ground floor, second may be at first floor, and third may be at second floor. So in one premises, there may be 3 factories. In these 3 factories, common facility is to be given by the owner of the facility. Thank you very much.
Thank you very much, sir, for this wonderful presentation. Very informative presentation, actually. Many of us were not aware about these rules, so it's very important that we know them, so that it's for our safety and it's for industries. It is under industries compliance that they need to follow these rules for the betterment of their employees. So thank you very much, sir. I now request our next speaker, Sri Nakul Tarun sir. He is known as a founder of Zone 4 Solution and known for disaster management services with the single aim of reducing risk to businesses and life and taking care of emergency response. He was deputy director with Directorate General of NDRF and Civil Defense, Ministry of Home Affairs, Government of India. In his stint at MHA, he accomplished the successful fire hazard and risk analysis of all districts of the country. He also served international welfare agencies such as United Nations Development Program in India. These opportunities helped him understand the deep problems in our societies that we face and brought to more closer to philanthropy and humanity. He also served as a South Asian Association for Regional Cooperation, that is SARC, Disaster Management Center, and it's a regional center that you know where Afghanistan, Bangladesh, India, Bhutan, Maldives, these countries are the stakeholders. These few countries, and he is also responsible for implement agreements on rapid response on disaster management in SARC region. In this process, he developed standard operating procedures for the regional response training manual for SADMETs. I request sir for his deliberation, please. Nakul Tarun sir.
Thank you, Silky.
Yes, sir.
अदरवाइज मैं फील्ड का आदमी हूँ और जो प्रैक्टिशनर जिसे बोलते हैं, जो ग्राउंड स्पेस वर्कर होता है, तो मैं शुरू से ये पूरा प्रोग्राम सुन रहा था और काफी अच्छा लगा। सब लोगों ने जैसे पूरे अभी तक के प्रोग्राम को सुनने से ये समझ में आया कि हम लोग पॉलिसी लेवल पे बिल्कुल क्लियर हैं। जैसे फायर से अतुल गर्ग साहब आए, उन्होंने फिर फायर से डॉक्टर संजय आए, उन्होंने भी बताया कि हमारे पास ये प्रोविजन ऑलरेडी है। फिर उसके बाद प्रोफेसर साहब आए, उन्होंने भी प्रोविजंस बताए। इसका मतलब क्लियर है कि वी आर हम लोग रेजिलिएंट होने के लिए पॉलिसी है हमारे पास। अभी जो फैक्ट्री के डिप्टी डायरेक्टर थे सोमानंद राणा साहब, उन्होंने भी बताया कि देखिए कैसे हम लोग फैक्ट्री का कैसे इंस्पेक्शन करते हैं, क्या प्रोविजन है ऑलरेडी फैक्ट्री एक्ट में। अब हम इसी चीज को ग्राउंड पे बात करते हैं कि कैसे रेजिलिएंट जो हमारा प्रोग्राम का जो थीम है कि रेजिलिएंट कैसे होंगे हम। आशीष पांडा साहब ने सब कुछ बताते हुए एक चीज और बताया उन्होंने कि रिकवरी पे जोर दिया कि देखिए इतना कोरोना हुआ और इतने लोग रिकवर हो गए। अब हम लोग ये समझते कि रिकवर हो गए, इस पे हम लोग क्यों बात कर रहे थे और पांडा साहब रिकवरी पे क्यों जोर दे रहे थे। देखिए जब तक हमारा रिकवरी का प्लान नहीं होगा, जब तक हम सही से हेलो
सर, यस सर,
सर बोले सर बोले।
वेरी गुड।
यस यस
करना चाहता हूं कि पांडा साहब कितने लोग रिकवर हो गए, तो जब तक हमारे पास रिकवरी का प्लान नहीं होगा, डिसास्टर मैनेजमेंट प्लान नहीं होगा, तब तक आप रेजिलिएंट हो ही नहीं सकते। रेजिलिएंट का मतलब क्या हुआ? रेजिलिएंट का मतलब ये हुआ कि डिसास्टर आएगा, अर्थक्वेक आएगा, फायर भी होता है, सुनामी भी आएगा, कोविड भी आ लिया अभी, और हम लोगों को वो एक्सपेक्ट अनएक्सपेक्टेड। कोविड कोई जानता था? नहीं जानता था। तो ऐसे ही जो अनएक्सपेक्टेड है वो भी आएगा, कोई ठिकाना नहीं है। किसी दिन गंगा घूम करके जमुना में बहने लगे, कोई ठिकाना नहीं है। तो हम लोगों को उसका एक प्लान होना चाहिए हमारे पास कि देखो जी प्लान कैसे होना चाहिए। प्लान रिस्क वाइज होना चाहिए, प्लान रिपोर्ट नहीं होना चाहिए। प्लान जो है ऐसा होना चाहिए जिसको हम इंप्लीमेंट कर सके, ट्रांसलेट कर सके। अब हम लोग एग्जांपल लेते हैं छोटा कि लेट से अभी हम वेस्ट डिस्ट्रिक्ट की बात कर रहे हैं, तो वेस्ट डिस्ट्रिक्ट का डिसास्टर मैनेजमेंट प्लान, रिकवरी प्लान होना चाहिए। क्या होना चाहिए? वो ऐसे होना चाहिए कि जब भी कोई डिसास्टर हो तो उस प्लान को हम लोग एक्टिवेट करें, उस रिकवरी प्लान को हम लोग एक्टिवेट करें। लेट से एग्जांपल कि अभी कोविड चल रहा है, तो कोविड में जो डिसास्टर आया, कोविड आया जब, तो इसे रिस्पॉन्ड करने का अपने पास प्लान तो होना ही चाहिए। लेकिन अब 9 महीने हो गए, हम रिकवरी प्लान है हमारे पास क्या? रिकवरी बोला तो पहला एग्जांपल लेट से हम लोगों ने 9 महीने से स्कूल को बंद कर रखा है ना। तो पूरा साल का जो एजुकेशन करिकुलम बच्चों का जिनका वेस्ट हो गया, आई एम नॉट टॉकिंग अबाउट द 23,000 ऑफ स्कूल इन इंडिया जो सीबीएसई से एफिलेटेड है, चाहे जो वेल टू डू फैमिली के लिए, मैं उनकी बात नहीं कर रहा। मैं उनकी बात कर रहा हूं कि अगर 32 करोड़ बच्चे हैं, 23,000 स्कूल छोड़ करके जो बाकी स्कूलों में पढ़ते हैं, उनका जो एजुकेशन लॉस हुआ उसको कैसे रिकवर करेंगे? उसको कैसे रिकवर करेंगे? जो इतना रेवेन्यू लॉस हो गया वो कैसे रिकवर करेंगे? डू वी हैव अ प्लान? हमारे पास प्लान है? नहीं है। ये मानता हूं कि आधा से ज्यादा डिसास्टर के केस में हम प्लानिंग नहीं फेल हैं। अगर हम प्लान अच्छा बनाएं तो मैं आपको गारंटी देता हूं कि आपका डिसास्टर जो रिकवरी प्रोसेस है वो बहुत आसान हो जाएगा। ऐसा पूरे वर्ल्ड का एग्जांपल है, ऐसा नहीं कि केवल हमारे यहाँ। जिन लोगों के पास अपना रिकवरी मैकेनिज्म है, अपना रिकवरी प्लान है, उनका भी बिजनेस स्टॉप होता है, उनका भी स्कूल बंद हुआ है, उनका भी ऑफिसेज क्लोज हुए हैं, फैक्ट्री बंद हुई है, लेकिन जिसका भी रिकवरी मैकेनिज्म अच्छा है। अभी एक छोटा एग्जांपल देते हैं मुंबई म्युनिसिपल कॉर्पोरेशन का, और भी भारत में दुनिया भर के म्युनिसिपल कॉर्पोरेशन है। मुंबई म्युनिसिपल कॉर्पोरेशन के पास कि एक अभी वो मुझसे डिस्कस कर रहे थे कुछ दिन पहले, तो उन्होंने मुझे बताया कि देखिए जी, मैंने उनसे एक सवाल पूछा कि अच्छा ये बताइए, आप लोग बहुत बढ़िया ईओसी बना लिया है आप लोगों ने, अब मान लीजिए कि एक क्वेक आता है, सबसे पहले आपका ईओसी गिर जाता है, अब क्या करेंगे आप? डू यू हैव एनी बैकअप? क्योंकि सब कुछ तो ईओसी पे डिपेंड करता है, जहां से सारा मुंबई कोऑर्डिनेट होएगा, और आपने एक ईओसी बनाया है, अब पता चला कि वही फेल हो गया, अब क्या करेंगे आप? तो उन्होंने मुझे बताया कि नहीं, हमारा इस ईओसी का एक बैकअप भी है, और जो उस ऑफिस से जहां पे ईओसी है वहां से कोई 8-10 किलोमीटर दूर है, वो इंटेंशनली बनाया गया है कि लेट से फायर हो जाता है ईओसी में। अब हो सकता है ना, भूकंप आया ईओसी में ही कुछ प्रॉब्लम हो सकता है ना, कोविड आया ईओसी के सारे मेंबर को हो गया, ऐसा हो सकता है। सो उन्होंने एक ऐसा मैकेनिज्म डेवलप किया है कि जिससे अगर ये हमारा प्राइमरी ईओसी फेल भी हो जाता है तो एक बैकअप में है, वो काम करना शुरू कर देगा। तो हम लोगों को इस लेवल तक सोचना पड़ेगा जब हम प्लान कर रहे होते हैं। अगर आप प्लान में फेल हो गए तो ऑब्वियस सी बात है, इंप्लीमेंटेशन तो गलत ही होएगा, इसमें कोई डाउट है नहीं। और फिर हम बैठे रहेंगे कि अब रिकवरी करना कैसे है, और फिर हम क्या करेंगे, हिट एंड ट्रायल करेंगे। चलो ये करके देख लेते हो, ये तो अच्छा नहीं हुआ, चलो ये करके देख लेते हो, ये भी फेल हुआ, अच्छा ऐसा करके देख लेते तो ये भी फेल होगा, इसमें कोई डाउट नहीं है। प्लानिंग में हम लोगों को परफेक्ट होना पड़ेगा। प्लान, तो अब प्लान क्या होना चाहिए, प्लान होगा डिसास्टर मैनेजमेंट प्लान। कैसे बनेगा, हम लोग, जो हमारा सबसे ज्यादा काम है वो स्कूलों में है, तो मैं एक छोटा सा यूनिट स्कूलों को लेकर के बताता हूं, जिससे, क्योंकि सब लोग स्कूल से कनेक्टेड हैं और इस बात को सब लोग समझ सकते। कोई स्कूल में पढ़ा रहा है, कोई पढ़ रहा है, अगर हम नहीं पढ़ रहे तो हमारे बच्चे पढ़ रहे हैं, तो हम स्कूलों को ज्यादा बढ़िया समझ सकते हैं। एक स्कूल का डिसास्टर मैनेजमेंट प्लान बनाना है। अभी से राणा साहब बता रहे थे कि फैक्ट्री में हम लोग सेफ्टी ऑडिट करते हैं। एनडीएमए ने जो हमारा 2016 का डिसास्टर मैनेजमेंट एक्ट बनाया है, उसमें कहा है हर फैक्ट्री का डिसास्टर मैनेजमेंट प्लान भी होना चाहिए। अब हम लोग समझते हैं कि इतना इंफेसिस डिसास्टर मैनेजमेंट प्लान पे क्यों दे रहे हैं, कि भाई डिस्ट्रिक्ट का भी होना चाहिए, स्टेट का भी होना चाहिए, स्कूल का भी होना चाहिए, सोसाइटी का भी होना चाहिए, क्यों होना चाहिए। अभी देखिए, जितने भी स्टैंडर्ड है, जो अभी BIS के कह रहे थे, बिल्डिंग कोड कह रहे थे, फायर एक्ट कह रहे थे, फायर कोड कह रहे थे, जितने भी हैं कि बिल्डिंग ऐसे बनना चाहिए, इतना उसका FR एरिया होना चाहिए, इतनी हाइट नहीं होनी चाहिए। अब तो आगे वाले बिल्डिंग में आप एक बार इन्फोर्स कर लेंगे, जो अभी अब नई बिल्डिंग बनेगी उसमें हो सकता है आप एक बार इन्फोर्स कर भी लें, जो बनी हुई है उसका, जो बनी हुई उसका क्या करेंगे। हमारे पास कोई ऐसा मैकेनिज्म होना चाहिए कि जो बना हुआ है उसका डिसास्टर रिस्क रिडक्शन हो। कैसे, कोई बना हुआ स्कूल है गली में, मैं कह रहा हूं कोई बना हुआ स्कूल है, तो अब बना हुआ स्कूल गली में है, आप देखिए उसको आप फायर का NOC देंगे नहीं, क्यों, क्योंकि वो मानक पे आएगा नहीं, जो स्टैंडर्ड है उस पे आएगा नहीं। वो जो फैक्ट्री गलियों में चल रहा है उसको, वो तो गलियों में चल रहा है, तो अब करेंगे क्या, तो उस कैसे होगा। तो सबसे अच्छा बीच का रास्ता है कि हम सबसे पहले कहें कि भाई देखिए, आप अपना डिसास्टर मैनेजमेंट प्लान बनाइए। कैसे बनाइए, डिसास्टर मैनेजमेंट प्लान एक क्वालिफाइड डिसास्टर मैनेजमेंट एक्सपर्ट बनाए और वो ओन करे, उसको साइन करे कि जी मैंने बनाया, कि कोई तो रिस्पॉन्सिबिलिटी ले ना। अब जब वो बनाएगा तो क्या करेगा, कैसे बनाएगा, प्लान ऐसे होना चाहिए रिस्क वाइज। जैसे मैं हूं और आशीष पांडा जी हैं, दो लोग हैं, तो हम दोनों को का रिस्क अलग है। वो गाजियाबाद में रहते हैं, मैं दिल्ली में रहता हूं, हमारे द्वारका के बगल से फॉल्ट रिज गुजरा है, उनके यहां से नहीं गुजरा है। वो जो है वो एक रिवर के किनारे रहते हैं, तो उनके यहाँ फ्लड आ सकता है। हमारे द्वारका में पीने का पानी नहीं है, तो फ्लड कहां से आएगा। तो हर जगह पे अलग अलग रिस्क है, तो प्लान कैसे बनेगा, रिस्क के हिसाब से। अब ऐसे समझते हैं कि हम लोग कह रहे हैं कि चलो इतना इक्विपमेंट हमारे पास है, कैसे पता आपके पास जो इक्विपमेंट है वो सफिशिएंट है। हम कह रहे हैं कि हमारे पास 12 बटालियन है NDRF का, और 12 क्यों है, 24 क्यों नहीं है, 36 लगा लेते हैं, पूरे भारत को NDRF बना देते हैं। कोई लॉजिक होना चाहिए ना, नहीं होना चाहिए कि जितना रिस्क है भाई, जितना बीमारी उतना ही दवाई लेंगे ना आप, कि पूरा दुकान खरीद के ले आएंगे, चलो भाई अब हो गया, ऐसा नहीं चलेगा। हमें, हमारे पास इतना रिसोर्स नहीं है, तो हमें चेक करना चाहिए कि कितना रिस्क है। एक स्केल मान लेते हैं कि 10 का स्केल है, जहां रिस्क 1 है तो वहां पे रिसोर्सेज कम लगाने चाहिए मुझे, है ना। जहां पे रिस्क 9 है वहां पे रिस्क ज्यादा है, तो रिसोर्स भी ज्यादा लगाना चाहिए। तो ये कौन करेगा? वो क्वालिफाइड डिसास्टर मैनेजर बताएगा कि देखिए आपको ऐसे 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 करना है। तो हर जितने भी यूनिट है, स्कूल है, फैक्ट्री है, सिनेमा हॉल है, सोसाइटी है, हमारा घर है, चलिए, तो हमें एक डिसास्टर मैनेजमेंट प्लान बनाना चाहिए। अब मैंने कहा कि हाईलाइट करेंगे स्कूल वाला, क्यों? क्योंकि सब लोग कनेक्टेड हैं। जनरली मैंने देखा है कि एनडीएम ने गाइडलाइन कहा कि जी स्कूल में इवैक्यूएशन मैप लगाइए। स्कूल वाले लगाते भी हैं, मजेदार बात यह है, और जो ऑडिट करने जाते हैं वो भी चेक करके आ जाते हैं। इसका मतलब ये हुआ, तो बताता हूं कि अभी तक का 1% भी स्कूल नहीं होगा भारत में जिसमें जो इवैक्यूएशन प्लान है वो एट पार लगा हुआ होगा। क्यों नहीं लगा हुआ है? क्योंकि इन्फोर्समेंट हमारा अच्छा नहीं है। पॉलिसी बहुत अच्छा है, जो डिसास्टर मैनेजमेंट गाइडलाइन है हमारा वो बहुत ही अच्छा है, उसमें कोई कमी नहीं है। हमारा इन्फोर्समेंट, और ये कहिए कि हम उसको इंटरप्रेट सही से नहीं कर पा रहे हैं, हम उसको सही से इंटरप्रेट और ग्राउंड में ट्रांसलेट सही से नहीं कर पा रहे हैं। कैसे? एक हमारे पास एग्जांपल देखिए, एक स्कूल वाला आता है, वो मोहित बहुत बढ़िया बताएगा क्योंकि उसी के पास जमा होता है। वो 4 पेज का डिसास्टर मैनेजमेंट प्लान एक टेबल बना करके, टीम बना करके केवल ले आता है, बोला जी ये डिसास्टर मैनेजमेंट प्लान है। एक फॉर्मेट है स्टैंडर्ड, उसको भर के ले आते हैं। अच्छा बताइए, एक स्टैंडर्ड फॉर्मेट कैसे हो सकता है भाई? एक ही जगह पे 2 स्कूल है, उसका 2 रिस्क होगा। वो हो सकता है बढ़िया कंक्रीट का बना हुआ, अगला वाला ऐसे ईंट गारा पे बना हुआ हो, तो उसका अलग रिस्क होगा। तो एक प्लान तो हो ही नहीं सकता किसी भी 2, 4, 10 स्कूलों का, हो ही नहीं सकता। भले ही एक दीवार के साथ बने हुए हो, अलग रिस्क होगा उसका। आदमियों के अलग बीमारी है, वैसे 2 स्कूलों के अलग बीमारी है, उसका अलग इलाज होना चाहिए। एक और एग्जाम्पल, मोहित अच्छा ग्राउंड पे, वो भी हमारे जैसा ही आदमी ग्राउंड पे रहता है। दूसरा क्या है कि स्कूलों में वो मैप लगाते हैं कागज वाला, फैक्ट्रियों में भी आप जाएंगे, वीराना साहब, तो फैक्ट्रियों में भी जाएंगे तो इवैक्यूएशन मैप वो लगाए हुए होते हैं, ऐसा नहीं लगाए हुए होते हैं। कागज पे पेंसिल से बनाते हैं वो फर्स्ट क्लास, और उसे चिपका देते हैं शीशा में मढ़ा करके, सुंदर लगने के लिए। अरे वो सुंदर लगने के लिए थोड़ी ना बनाया हम लोगों ने, उसको सेल्फ ग्लो मैप बनाना था। लॉजिक ये है कि जब धुआं होगा, फैक्ट्री में जब आग लगेगा या भूकंप आएगा तो क्या होगा? सब चली जाएगी, चली जाएगी, दिखेगा नहीं। आप चलो दिख भी जाएगा। मैं गया था एज ए विजिटर, अब मैं क्या करूं? मुझे क्या पता, मुझे तो कोई बताएगा तभी नहीं जाऊंगा मैं। अब जिस समय डिसास्टर आएगा उस समय मुझे तो कोई गाइड कर नहीं रहा होगा, सब अपनी जान बचा कर भाग रहे होंगे। तो भाई मेरे लिए भी है कि इवैक्यूएशन में पैसा लगा दीजिए जिसे देख के मैं भाग लूं। तो वो सेल्फ ग्लो मैप लगाना है, वो कागज वाला मैप नहीं, सेल्फ ग्लो मैप, जिसे मैं कह रहा हूं जो फ्लाइट में लाइट बंद कर देते हैं तो हमें डोर दिख रहा होता है ना, डोर का रास्ता, तो वैसे स्कूल में क्यों नहीं दिख सकता, वैसे फैक्ट्री में क्यों नहीं दिख सकता, सिनेमा हॉल में क्यों नहीं दिख सकता? मतलब ये कि हम इन्फोर्स नहीं कर रहे हैं और दिखाने वाला का इंटेंशन नहीं है कि दिखे। अदरवाइज इतना महंगा भी नहीं, बहुत सस्ता एक्टिविटी है कोई ये, क्योंकि हम लोग कर रहे हैं तो मुझे पता है कि कितना कॉस्ट आता है। इवन वो इतना सस्ता है कि एक ऑडिट से सस्ता है, तो हमें करवाना चाहिए। लेकिन मैं यही करता कि पॉलिसी लेवल पे हम बहुत ही बढ़िया है, एक स्टैंडर्ड है हमारा, नीचे जा करके हम लोग फेल हो जाते हैं इंप्लीमेंटेशन में, उसको ट्रांसलेशन में, इंटरप्रिटेशन में। अभी जैसे एक और ब्रॉडर एग्जांपल लेते हैं कि जो मैं कह रहा था कि अच्छा बताइए, जो हमारा इतना सारा एजुकेशन लॉस हो गया, इतना हमारा बिजनेस लॉस हुआ, अगर हमारे पास रिकवरी प्लान होता, जो हमारे पास अगर रिकवरी प्लान होता, नेशनल रिकवरी प्लान, तो हम लोग उसको अब तक एक्टिवेट कर चुके होते। लेकिन नहीं होता तो जरूर एक्टिवेट किए हुए होते कि अब ऐसे ऐसे ऐसे। भाई जैसे रिस्पॉन्स था, रिस्पॉन्स का मैकेनिज्म था हमारे पास, तो हम लोगों ने रिस्पॉन्स का मैकेनिज्म अप्लाई किया। मिनिस्ट्री ऑफ हेल्थ ने बताया कि देखिए हम ये कर रहे हैं, हम ये कर रहे हैं, हम ये कर रहे हैं, हम ये कर रहे हैं। अब रिकवरी का मैकेनिज्म हमारे पास प्लान है ही नहीं, तो एक्टिवेट क्या करें? तो हमें एक कंप्रिहेंसिव रिकवरी प्लान होना चाहिए। अदरवाइज जो डिजास्टर मैनेजमेंट की बात कर, जो रिकवरी का मेथड नहीं होगा हमारे पास, तो हम उसमें फेल हो जाएंगे प्लान में। ये मेरा पर्सनल ऑब्जर्वेशन है ग्राउंड का। अदरवाइज अगर हमारे पास रिकवरी का प्लान होता तो आई एम श्योर कि अब तक जो चीजें बंद थी वो अब तक नॉर्मल हो चुकी होती, क्योंकि हमारे पता होता कि क्या करना। ऐसे ही आज कोविड आया है, कल डेविड आएगा, परसों सोमिड आएगा, आराम जाने कौन कौन आएगा। तो ऐसी भाई साल भर तो देश और दुनिया का क्या होगा। ये तो कोई एक छोटा जो फैक्ट्री का जो पिन है वो भी क्या करेगा, उसको सबसे आसान तरीका है जी, फैक्ट्री नुकसान में इसे बंद कर दो, है ना। कोविड आया, स्कूल बंद कर दो, बंद कर देना आसान है, लेकिन मैनेजर तो तब है आप ना कि उसको फिर खोल लें आप। अदरवाइज इतने बड़े बड़े हमारे जैसे एक्सपर्ट की जरूरत क्या है, वो तो नीचे वाले सिविल डिफेंस वॉलंटियर ही बंद कर लेते। तो बंद करने के लिए हम लोग हैं कि हम लोगों का काम है उसको चलाना, वो सिस्टम चले, इसलिए हम लोग हैं, बंद करने के लिए हम लोग नहीं हैं। तो फिर से मैं इसको एम्फेसिस, मुझे पता है कि हम लोग ऑलरेडी देर हो गए हैं, वो मुझे सिल की देखना शुरू कर दी है, ठीक ना। तो मैं अपना बात कह करके खत्म करता हूं कि अगर आप प्लान बनाने में सक्सेसफुल हैं तो फेल होने का चांस बहुत कम है आपका। तो बेटर है कि इन्फोर्स करें, डिसास्टर मैनेजमेंट प्लान बने, और बने नहीं उसकी एक कॉपी डीडीएमए में जमा हो, और डीडीएमए वाले उस अपने जो इमरजेंसी सपोर्ट फंक्शनरीज हैं, 12 इमरजेंसी सपोर्ट फंक्शनरी है कि ताकि फायर भी जागे रहें, जल बोर्ड वाले भी जागे रहें, हेल्थ वाले भी ऐसा लगता है कि डिसास्टर मैनेजमेंट डीडीएमए का काम है, इनका काम है सबको कोऑर्डिनेट करना, तो ये करते नहीं, सबको जगाए रखना भी इनका काम है। अब रही बात कि कोई नहीं बनाता है, तो इनके पास बहुत पावर है डीडीएमए वालों के पास। मैं इनको बताता हूं, हनुमान जी की तरह आपके पास बहुत पावर है, आप किसी भी स्कूल को नोटिस भेज सकते हैं, किसी भी फैक्ट्री को नोटिस भेज सकते हैं, उसको बंद कर सकते हैं, इतना पावर है आपको डीडीएमए एक्ट में। लेकिन जागिए भाई, क्योंकि इंप्लीमेंट आप ही को करना है। पांडा साहब, ये सब लोग जो ऊपर से हैं, वो गाइडलाइन आपको पॉलिसी बता सकते हैं कि ये होना चाहिए, ये होना चाहिए, ये होना चाहिए, करना आप ही को है, करिए, क्योंकि आप लोग वो कड़ी हैं जो ग्राउंड में खड़े हैं। तो मैं यही कह करके खत्म करना चाहता हूं। आप सबको धन्यवाद, आपने मुझे सुना। मैं थोड़ा कड़ा और कड़वा बोलता हूं, तो मैं ज्यादा बोल गया हूं, तो मैं ग्राउंड का आदमी हूं, मैं बोलूंगा ऐसा, है ना। तो मैं पहले ही सबको सॉरी बोल देता हूं। थैंक यू।
थैंक यू सर। ऐसी बात नहीं है सर, सच्ची बातें अक्सर कड़वी होती हैं। आपने सही कहा कि पॉलिसीज वगैरह सब हैं और इम्प्लीमेंट करना नीचे जो ऑर्गेनाइजेशन है ग्राउंड लेवल पे, उन्हीं का काम है। हम लोग सिर्फ एडवाइस दे सकते हैं, हम लोग गाइडलाइंस जारी कर सकते हैं, बट एट द एंड काम उन्हीं का है। स्कूल, फैक्ट्रीज, ये सब ऑर्गेनाइजेशन इन्हीं को इम्प्लीमेंट करनी है सारी चीजें। तो थैंक यू वेरी मच सर फॉर योर टाइम एंड दिस अमेजिंग lecture of yours, and we enjoyed it actually. Thank you very much, sir. So, as we have completed our technical session, now we will move towards our prediction. So, I request Mr. Mohit Sharma from DDMA to kindly summarize today's webinar and deliver his talk. Sir.
थैंक यू सो मच मैम। एक छोटा सा 5 स्लाइड का प्रेजेंटेशन शो करना है मैडम, उसको जरा हमारा
मोजी, मैं सिर्फ बीच में इंटरवीन कर रहा हूँ, सॉरी इंटरप्ट कर रहा हूँ। मैं एक बात इसमें नकुल तरुण जी ने जो बोला उसमें एक चीज ऐड करना चाह रहा हूँ। देखिए, डीडीएम में जो ज्यादातर हम लोगों को ज्वाइंट इंस्पेक्शन के लेटर्स वगैरह आते हैं, वो ऐसी प्रेमिसेस और ऐसे जगह आते हैं जहां पर हमने ऑलरेडी प्लान स्ट्रक्चर होते हैं, एनॉक्स के अकॉर्डिंग बनी हुई होती है वो बिल्डिंग, जैसे मॉल्स हैं और मल्टीप्लेक्सेस हैं। हम उन चीजों को बिल्कुल ध्यान नहीं दे रहे हैं, जो मैंने अपने प्रेजेंटेशन में हाईलाइट किया था कि ज्यादातर फायर कंडीशन और डेथ्स जो हो रही हैं वो अनऑथराइज अनप्लान्ड स्ट्रक्चर्स में हो रही हैं। जो हमारे घर हैं ग्राउंड स्टिल्ट+4 जो बिल्डिंग्स हैं, जिनके अंदर एक ही जीना है और वहां पर रास्ते के अंदर ही उनकी बिजली के मीटर बोर्ड लगे होते हैं, ऊपर का जो अल्टरनेट एग्जिट छत पे जाने का रास्ता है वो बंद है। तो हम डीडीएम में को ऐसी चीजें फोकस करनी चाहिए जब हमारे पास एनालिसिस है, हमारे पास डाटा रिकॉर्ड, हमने एनालिसिस किया है और हमने जो चीज फाइंड की है उसकी तरफ किसी का ध्यान नहीं है। वी आर टॉकिंग अबाउट हाई राइज बिल्डिंग। मैं आपको ऑन रिकॉर्ड कह सकता हूं कि हाई राइज बिल्डिंग में फायर होती ही नहीं है। जिनके अंदर हम रेगुलर इंस्पेक्शन करके एनओसी देते हैं वहां पे नंबर ऑफ फायर मैंने आपको अपनी प्रेजेंटेशन में भी दिखाया था, बिल्कुल जीरो है। ये कमी वहां ज्यादा डेथ के चांसेस और ज्यादा फायर इंडस्ट्री जो जैसे रेजिडेंशियल प्रेमिसेस के अंदर फैक्ट्रीज चल रही हैं जिनके अंदर एक ही जीना है, वहां पे प्रॉब्लम है। तो हमारा जो फोकस है वो आपके माध्यम से मैं ये बताना चाह रहा हूं कि हमें उस चीज को ज्यादा फोकस करना चाहिए, बजाय हम ऐसी बिल्डिंग्स को फोकस करें जहां पे ऑलरेडी फायर सेफ्टी के इंतजाम है। थैंक यू वेरी मच।
Okay, sir. Thank you so much, sir.
Thank you, sir.
Okay, shall I start? Okay. एक छोटा सा प्रेजेंटेशन है डिस्ट्रिक्ट वेस्ट के पॉइंट ऑफ व्यू से।
सर इसको फुल स्क्रीन कर दीजिए प्लीज।
स्लाइड्स होना हो गया। Okay. This is the map of West District. You can see that the map of West District. There are 3 subdivisions in West District. One's Punjabi Bagh District, Punjabi Bagh subdivision, Rajouri Garden subdivision, and Patel Nagar subdivision. You can see this is the large one, Punjabi Bagh subdivision. This is the area of Punjabi Bagh subdivision, and the blue one is Patel Nagar, and small one is Rajouri Garden subdivision of District West. This is a small brief. The West District spreads over an area 110.56 square kilometer, which is the 4th largest one in Delhi. Boundaries. The district has common boundaries with the Northwest, Central, New Delhi, and Southwest District. It shares its west boundary with the Jhajjar District of State Haryana. The total population of the district is 25,40,000 to 243 lakhs, according to census, with an overall density of 19,563 persons per square kilometer. This is the list of hazards in District West: earthquake, fire, building collapse. Fire and building collapse is most frequent occur in West District. Terrorist attack, because there are malls, cinema, hotels, and metro stations. Epidemics, flood, CBRN disaster, because there are 2 major installations, HPCL and 1 water treatment plant at Kamruddin Nagar. Punjabi Bagh, road accidents, rail accidents, and stampedes. Metrics of post disasters. There is 1 control room working 24/7 under the aegis of Disaster Management Authority. The table we are now going to share the table of past disasters from since 2009 to 2020. You can see fire, building collapse. Fire is one of the most frequent disaster in District West. Building collapse is second one. Balcony collapse, roof collapse, wall collapse, road accidents, mocktails. You can see the number of the incident occurred in 2020. Fire to 204, which one is the highest. We have created relief centers in District West subdivision wise. We have created schools, colleges, parks, university grounds in relief centers. Government Girls School, Senior Secondary School, Punjabi Bagh, SPM College, District Park, Piragadi, Punjabi Bagh, Ambedkar University, Shivaji College, Government Boys Senior Secondary School, Rajouri Garden, Government Sarvodaya Vidyalaya, Rajouri Garden. There are 7 relief centers in District West. This is the map of relief center. We have mapping also all relief centers. And staging area is one of the important when big earthquake and any big disasters occurred. Panjai Bagh subdivision, there are 3 staging areas because the Panjai Bagh division is bigger one than other 2 subdivisions. Patel Nagar subdivisions, Rajouri Garden subdivisions. There are 8 staging area in District West. All staging areas have been mapped. We have created other vulnerable maps of District West recently with the help of GSDL. You can see the resource map of West Delhi. All ESFs, emergency support functions, colleges, park, fire stations, staging areas, and police stations, water centers have been mapped in this. This is the hazard, earthquake hazard-prone areas. All areas of District West falling in earthquake zone 4. But we have highlighting some important clusters which are prone to building collapse and roof collapse also. This is the fire-prone areas of West Delhi. You can see the pink one. This is the area of Panjai Bagh where major industries settled there. Emergency support function, all office emergency support function, all stakeholders have been offices have been mapped to respond immediately on incident site. This is a stampede prone area. All major hospitals, metro stations, hospital, malls, cinemas have been mapped with emergency support functions and ESFs. This is the even we have mapped waterlogging areas where urban flooding occur in monsoon sessions. There are 35 points, major points where waterlogging occurs in West Delhi. Well, we have colored map of vulnerability prone areas. You can see the pink one is higher vulnerability areas and green one is moderate. Higher vulnerability because there is major installation, industries. This is the risk prone areas of West Delhi. You can see the red one is highest, pink is moderate, or yellow one is lowest. Thanks. Thank you so much. This is our big presentation.
Thank you very much, sir, for showing this presentation.
I want to share the comments of Nakul sir. On his guidance, we are working with the schools on school safety, and we call all teachers from schools and aware about the school safety policy of NDMA. We are also coordinating with all hotels, malls, cinema to prepare their disaster management plan, which is very important in case of any big earthquake or any big disasters. Our metro stations, our major industrial areas have been submitted their disaster management plan in the last 15 days before. Thank you so much, ma'am.
Thank you so much, sir. I see a few questions in the Q&A box. Can I ask, sir?
Yes,
please.
Yes. How many workforce is with ADM West? How they put on job? What all are the checks and mandates are being undertaken to see proper implementation?
Pardon, ma'am?
How many workforce is with ADM West? How they put on job? What all are the checks and mandates are being undertaken to see proper implementation?
Under the ADM is CEO of DDMA, and there are 4 staff of DDMA and 1 DPO and 2 project coordinators. 4 persons working in emergency operations center and 12 persons working in quick response team. We are and civil defense volunteer, and now in COVID situations, I think 1,000 of civil defense force is working under his supervision. to respond in any query to solve COVID-19 problems. And we are working on school safety, preparing of disaster management plans. Now in COVID situations, we have monitoring or ambulance, dead bodies of COVID-19's, criminations, and containment zone, or and we are also hunger relief line, hunger relief centers, or night shelters, or food distribution centers, and many more things.
Good, sir. That's really great. Another question, not just for you, for all the panelists who are available. How to see the implementation of MHA, MOHFW guidelines being implemented on ground? How many diversions are noted with respect to DDMP, NDMP, etc.? What actions can be taken to note these in record? Ashish sir, or Somendra Rana sir, or anyone would like to
No,
answer?
the question you have asked that is related to
Hazardous waste management. Is it related
no,
to
that is
hazardous
related
waste
to
management
DDM
or
and
what?
SDMA. Yeah.
Yes.
The guidelines are there to be followed. Okay, so whether this is being followed or not, I mean, taking stock of that thing, I don't think during this time of pandemic that is possible to collect information with respect to that. But yes, all the agencies which are involved, I'm not the right person to answer this because the question is related to DDM and SDMA and specifically meant for Delhi. So but the generic way, I would say that guidelines are there to be followed, and it is not time that we should take a stock of that who is erring or not. To the maximum extent possible, we should be moving towards those direction where most of the people are provided proper awareness in this regard, and they should be encouraged rather to follow guidelines. It's like that.
I would like to throw some light on this.
Please, sir, please.
As far as this hazardous waste management and handling rules are concerned, as such in Delhi, there is no factory which is handling hazardous waste. Means they are generating hazardous waste, then keeping the hazardous waste with them. And hazardous waste disposal site is identified by Delhi, I think near Bhavana or somewhere. But any installation, if it comes to deal with that hazardous waste, then only then that factory will be registered in Delhi.
Yes, sir. And to add to that point, that if we talk about hazardous waste, then probably we are observing incidents in the area of Vijag, and then in Gujarat, or probably in some areas of Madhya Pradesh and Chhattisgarh, where these chemical explosions have taken place, where probably these guidelines have not been followed in toto. So that is it.
Sir, just one last question I would like to take. How alerts were used in early warning system and to connect first responders in DDMP implementation?
That is Mohit has to answer. DDMP.
Yes, yes.
Yes, sir.
Alerts because in on ground level if we talk about on district west, there are 16 divisions of civil defense. Every division have wardens, post warden, deputy wardens, and if any alerts receive on district level, we will spread on ground level to respond immediately. If any disasters occurs in district west, we coordinate with all ESF emergency support functions, Delhi Jal Board, firefighting, Delhi Fire Service, MCD, PWD, DDA, to respond immediately on incident side and work to assist any type of relief work there, and to do as their job on ground level.
Okay, thank you very much, sir. There is one last question about fire incident. जब 107 पर कॉल की जाती है किसी फायर की, तो कहा जाता है कि फायर को कॉल कीजिए, डिजास्टर मैनेजमेंट नंबर पर हमें सर्विस क्यों नहीं मिलती?
क्या मैडम व्हाट
सर 1077 पर कॉल की जाती है किसी फायर की, तो कहा जाता है कि फायर को कॉल कीजिए डिजास्टर मैनेजमेंट नंबर पर, हमें सर्विस क्यों नहीं मिलती फायर की?
ये तो 1077 पे कॉल किया जाता है जो नहीं, बिकॉज फ्रॉम हेडक्वार्टर से सारा का सारा मॉनिटरिंग किया जाता है। अगर हेडक्वार्टर में 1077 पर कोई भी कॉल आती है तो जो एड्रेस होता है उस कॉल का उस डिस्ट्रिक्ट को फॉरवर्ड कर दी जाती है वहां पर कंट्रोल रूम को, है ना। कंट्रोल रूम ऑलरेडी फायर के पास हमसे पहले ही पहुंच जाती है वो कॉल। फायर वाले ऑलरेडी पैरेलली वहां पर पहुंच जाते हैं और हम कभी कभी है ना ऐसा भी होता है वो हमसे पहले पहुंच जाए। फायर इज दिल्ली फायर सर्विस का हम कोई यानी नहीं बोल सकते कि वो नहीं पहुंचते हैं, बिकॉज हम जो जितने भी देखते हैं फायर इंसिडेंट मैनेज हो रहे हैं दिल्ली फायर सर्विस ही करती है, और जितने फायर फाइटर हैं बहुत अच्छा काम करते हैं, क्योंकि हम जब जाते हैं ग्राउंड लेवल सभी से हमारा कोऑर्डिनेशन होता रहता है। दे आर वर्किंग वेरी नाइसली, है ना, तो इसमें कोई है नहीं।
Thank you very much, sir. You have wonderfully answered all the queries. So I hope our participants are satisfied and thoroughly, in knowledge with your answers. So I request now Ashish Panda sir to kindly conclude the session.
Thank you, Shilki. As we all know that this was a wonderful program and that we could cover wonderful aspects of pandemic health emergency, fire safety, air pollution, mental well-being, industrial and factory safety, need for disaster management plan, etc. We hope that many such programs will be organized in future for better awareness and better information dissemination and also knowledge sharing. We also learn from people for the benefit of one and all. If we talk about this, the topic of today's webinar, that is urban disaster risk resilience. So I want to highlight Honorable Prime Minister 10-point agenda with respect to disaster risk management that beautifully covers the areas which should be properly highlighted with respect to urban disaster risk resilience. Sir says that all developmental sectors must imbibe the principles of disaster risk management. We have to work towards risk coverage for all. Inclusive growth should be there. Nobody should be left behind in a disaster kind of situation. And we need to encourage greater participation and leadership of women folk in disaster risk management, which is more than 50% population in our country. We have to go for risk mapping that Nakul sir was talking about, and leverage technology for DRR. Tomar sir talked about how drone kind of technology that is being used in as far as Delhi Fire Service is concerned, and building local capacities and initiatives so that the population that is migrating from village level to block level to tier 1, tier 2, tier 3 cities, that can be stopped and they can be provided all kinds of facilities with respect to disaster risk reduction, so that there will be inclusive growth for everybody. Then last but not the least, we should learn from every past disaster. We should not lose any opportunity with respect to learning from these disasters, so that we strengthen ourselves, our capacities with respect to how we deal with disaster. Disasters will always be there. They will differ from each and other disaster, but definitely we can learn from past disasters and strengthen ourselves. So we have to talk about smart cities. We have to talk about resilient society, inclusive growth. It has to be rural. It has to be urban. Like Professor Anil rightly talked about, this peri-urban is a new area that is not purely rural, not purely urban. So those issues have to be talked about, and some policy should be there. Then robust DM plan should be there that can be implemented at the ground level. Efficient implementation is very, very important. We have to also work towards mitigation processes. That if you talk about the whole disaster management cycle, that mitigation is very, very important. Recently, this 15th Finance Commission has spoken about mitigation funds. Every 20 rupees of the 100 rupees that is being provided by the government, be it central government or the state government, 100 में से 20 रुपए जो है आप mitigation पे आप खर्च कर सकते हैं. तो we have to talk about those issues of mitigations. Then this is a time of multi-hazard scenario. So one area will be impacted by many disasters put together. So we have to bring all the stakeholders on one platform. So multi-stakeholder holistic approach we have to follow, and so that our common aim, that is disaster resilient society in times to come, we can achieve definitely. So my special thanks to Director of Fire Services Shri Atul Garg ji, Professor Anil Gupta ji from NIDM, ADM Delhi West Shri Dharmendra Kumar ji for beautifully conceptualizing this program and also helping us out with respect to how to go about it. My sincere thanks to all our esteemed speakers for sharing their experiences today with respect to urban disaster risk resilience, and Professor Jugal Kishore Dr. Sanjay Tomar Shri Somendra Pal Rana and Shri Nakul Tarun I thank you so much for taking time out of your busy schedules and be with us. Please stay safe and blessed during these times of pandemic. Be vigilant, follow guidelines for safety, remain stress-free and help others. And Dr. Kalam's two things I want to share here, that he said once that if you want to really look handsome, then give your hand to some, means not helping others. And if you are beautiful, this is probably the gift of the God to you. But if you live beautifully your life, then this is your gift back to the God. So with those concepts of Dr. Kalam, we should lead our life forward. And this is rightly said that if we fail to plan, then probably we are planning to fail, not only in disasters, but in our normal day-to-day lives. So let us hope for the best, and together we will certainly move towards this is so-called disaster resilient society in times to come. So thank you so much. God bless. Thank you.
Thank you so much, sir. Thank you so much, sir. NIDM, sir. Professor Anil Gupta, sir. Ashish Panda, sir, to provide the platform at district level. Silky Madam, for better coordination, every time picking the phone and solving the query. Somendra Pal Rana came here and give his share his experience. Sanjay Tomar, sir, Jugal Kishore, sir, and or I mean Nakul, or especially Nakul Tarun, sir, highlighting the issue of recovery plan, very important. So thank you so much, sir. Thank you.
Thank you. Namaskar. Namaskar. सभी को धन्यवाद. Thank you.
सभी को धन्यवाद.
God bless.
Should I close, sir?
हाँ, please. Thank you. Thank you, Shilki.
Bye, sir. Bye.